Okay. So again, thank you for joining us and for this town hall called African Americans and the Coronavirus. I'm at the intersections of public policy, politics, and health. My name is Dr. Sekou Franklin, and I'm the president of the National Conference of Black Political Scientists. Um, the Again, we want to thank you for joining us, those people in our audience, both on Zoom and on Facebook. If we have any technical difficulties, we'll try to fix it quickly. So just hang in with us, bear with us a little bit. And I'm going to introduce the first group of panelists, and then when we take a break, I'll introduce the second half of the panelists. But before that, let me give a brief introduction. As has widely been reported, African Americans have been disproportionately impacted by the coronavirus in terms of preventable deaths and hospitalizations. The coronavirus, also known as COVID-19, has had a significant impact on health outcomes, on public health delivery systems, and our broader political culture. It has also reshaped public and private institutions, access to the voting booth, the census, the health status of incarcerated persons, and the most vulnerable residents in both urban and rural communities. In summary, this town hall offers several perspectives on what the coronavirus means for African Americans and the multifaceted predicament facing the most vulnerable communities. We have assembled a group of panelists, experts, who can speak on these topics. Yet before getting started, I want to make sure I do some housekeeping. First, I want to acknowledge and give thanks to NCOBPS, the National Conference of Black Political Scientists. Our organization has been around since 1969. I want to thank the Executive Council as well, and give special thanks in addition to Dr. Kalila Brown-Dean, who approached me with this idea of having a town hall, and special thanks to Alexis Harris of Clark Atlanta University, who also helped us out with advertising. In addition, I want to thank Health Leads USA, the co-sponsor of this event, and my wife, or I shouldn't say that, but my wife is works on racial equity for Health Leads USA, and was able to work with them and helping them to sponsor this event. So I want to make sure I acknowledge that as well. Health Leads USA is a nonprofit organization that is working on racial equity and providing healthcare services to under-resourced communities. It is currently assisting communities and families impacted by the coronavirus, particularly in the areas of affordable housing and food security. Before introducing the panelists, I want to outline the format. The first panel includes presentations, followed by a question and answer period. The second panel entails shorter presentations and an interactive discussion moderated by Dr. Kalila Brown-Dean, followed by a Q&A period. We will take questions through our Q&A portal that I'm moderating. And the reason for this is that it offers a secondary security system to take into account some of the issues around Zoom bombing and other kind of security concerns. So that offers an introduction. We hope to have a healthy discussion and offer some good information for our audience. And this video recording will also be posted at our website, perhaps as early as next week for those individuals who are not able to view this live. Okay. So let me introduce the panelists, at least the first half of the panelists, and then we'll turn it over to them to give individual presentations. Okay. So our first panelist that we'll have, and I'll introduce the entire panel before moving forward. Our first panelist is Ace Robinson, who works with the National Minority AIDS Council. He is a leading HIV/AIDS advocate and population health expert in Los Angeles, California. He has extensive experience working to reduce the impact of HIV/AIDS, tuberculosis, malaria, and other chronic diseases on vulnerable populations, not just in the United States, but also abroad, including in South Africa. Dr. Pete Silver also is a past president of NCOBPS, the National Conference of Black Political Scientists, and one of the country's leading experts on higher education. He's a founder of Silver and Associates, a full-service education consulting firm that assists colleges and universities. And he's a past president of Alabama State University. He's a provost and vice president of Clark Atlanta University, at least the past provost. And he also served as vice president for academic affairs at Savannah State and as vice chancellor, assistant vice chancellor at the university system in Georgia, and is one of the country's leading experts on higher education. Ty Rush is a doctoral student at UCLA and works with the UCLA Voting Rights Project. He's an expert in voting rights and has worked on voting rights and redistricting. He served as a fellow at the Common Cause office in Los Angeles. He assisted with the recent report by the UCLA Voting Rights Project titled Protecting Democracy, Implementing Equal and Safe Access to the Ballot Box During a Global Pandemic. And I want to encourage our audience, please, if you can do something, get that report. It's a must read, particularly when it comes to voter protection in the November 2020 election. Dr. Fred McBride is a redistricting and voting rights policy specialist at the Lawyers Committee for Civil Rights Under Law. He has over 20 years of experience in this area, including working as the redistricting coordinator for the Voting Rights Project of the ACLU. He worked in that position for 12 years. He has presented at redistricting hearings for over 100 jurisdictions in 23 states and the District of Columbia. And Dr. McBride, I should add, has also been training NCOBPS affiliate members and students in redistricting and mapping. And finally, for our first panel, we have Princess Williams, a doctoral student at the University of Michigan. Her research looks at geographic residence and its impact on American political behavior. She also explores the ways in which subnational identities are developed over time and whether they inform African Americans and white American attitudes. She's one of the lead investigators of NCOBPS Black Rural Project, which focuses on the Alabama Black Belt, and she is part of a young group of scholars, I might add, one of the few group of political scientists who are studying Black rural behavior in the United States. So having said all of that, I will pause right there before we move on to the next panel. And I want to emphasize also one other thing before moving forward. Let me just make sure I point this out. The special thanks goes to Dr. Kalila Brown Dean. She is really the architect of this idea of having a town hall, and she will be moderating our second half of the town hall. She is an associate professor of political science at Quinnipiac University and the former faculty co-coordinator of the Health Policy and Advocacy Concentration in Quinnipiac's Medical School. She's a co-author of 50 Years of the Voting Rights Act, published by the Joint Center for Political Economic Studies, and recently authored the book Identity Politics in the United States. She serves as the chair of the board of directors of the Community Foundation for Greater New Haven, and she was an award-winning and well sought out speaker and thinker in the political science tradition. So I'm going to turn it over to our first panelist, and that person is Ace Robinson.
Hi, thank you so much for inviting me to take part in this panel. This is a very important conversation that we're having in light of the reality of our current healthcare situation. So as Dr. Franklin said before, my name is Ace Robinson, and my whole point of working in the public health sector is how are we going to really reduce the impact of health modalities and health disparities that really drive home into our community. Like when we're just not even talking, I focus specifically on HIV, infectious diseases, communicable diseases. And what we're trying to do is look at some of those unfortunate realities that have come into our world when it comes to the disproportionate impact of HIV, and now we're looking at the same thing of COVID-19. As you've seen for the last few weeks, you've seen a lot of people in my field who have taken over the COVID-19 task force because we really want to take the best practices when it comes to everything from testing to culturally responsive engagement, access to care, treatment, and prevention, and also access to testing. And how are we going to make sure that we don't make the same mistakes that we made in the land of HIV, now we have in the world of COVID-19? So just some of the background that I'm sure you already are aware of. We're in the middle of a massive pandemic. So within the US, we're getting close to almost 750,000 people being diagnosed with COVID-19. And remember, only less than 1% of people in the United States have actually even been tested for the virus. And we represent about 1/3 of the world's diagnoses. Already, unfortunately, we've had over 30,000 people succumb to the virus. I think many of us who have family in the Midwest and specifically in the Southeast and the Northeast are feeling this impact directly. And so this is why I think it's so important that we're having this conversation in a timely way and not looking at it in 6 months after, hopefully, that we have a reduction in this virus. So a little bit of that background that is very important. So who gets very sick from COVID-19? Now, we already know that older people, particularly people over, like we call it Medicare eligible, people who are more mature over the ages of 65, are more susceptible to advanced COVID-19 infection. Meaning that they'll have problems breathing, being intubated, being put on ventilators, and then unfortunately succumbing to the virus. And some of those individuals have other underlying medical conditions, and also the people who are younger, who are having advanced COVID-19 experiences, also have those underlying medical conditions as you see there. Some examples are high blood pressure, heart disease, diabetes, and pulmonary issues like COPD and asthma, and of course, untreated HIV, because as we know, people who are living with HIV who are on treatment don't experience some of these same issues. But if you're not on treatment, which is about half of people living with HIV in this country, unfortunately, COVID-19 is more of a player. So we already have that information. So let's talk about which communities are most likely to have those underlying medical conditions. So I think many of us know this, but it's important to say again that when it comes to things like high blood pressure and hypertension, Black people are highly disproportionately impacted by that modality. The same comes with heart disease, also with diabetes and untreated HIV. And it's also true with some of those pulmonary issues related to asthma and whatnot. And a lot of that is due to environmental toxins and other societal factors, which we'll talk about later. So what is the impact of those underlying conditions? It's not that Blacks are just disproportionately most likely to acquire COVID-19, but we are also more likely to die from COVID-19 if we acquire it. So there's been a lot of work done to get some of the preliminary data for who's actually acquiring and also dying from COVID-19. So we see in places like Michigan, where 70% of people who have been diagnosed with COVID-19 are Black, and the same goes in Chicago. And we're looking at what's happening in the New Orleans area, which has been all over the news. What's happening and also in northern Mississippi and rural Mississippi. We're seeing all over the country that Blacks and then also our Hispanic brethren and sisters are also being disproportionately impacted. We're seeing that in New York City, where Lower Manhattan is not being as stricken with the virus as we're seeing in places like in Queens and East New York, which is in Brooklyn. And this is also going to be true in some of those urban settings like Detroit. We got to really speak about that. And as I said earlier, rural Mississippi, and then my personal family is in southern Georgia, and a little town called Albany, Georgia is making the international news when it comes to the number of infections for such a small little area. That one little town has more deaths than even the city of Atlanta. So we know that a lot of attention has been paid to what's happening in Seattle and what's happening in New York, but then we have to actually look at the data. And the data really needs to be guiding our work. We need to look at public health information and really look at how we're going to address COVID-19 when it comes to prevention and treatment. So when it comes to infections per person, meaning if you take a city, and every city in the U.S. was approximately 1,000 people, which cities would have the most number of infections? We know number one is Detroit. Detroit is one of the few chocolate cities left in the country, and surprise, surprise, they are the most impacted city per population. And then the following, if you look, all 8 of the following 9 of the remaining 9 cities and regions are all found in the South. So whether we're talking about Georgia, we're looking at South Carolina, Tennessee, Mississippi, Louisiana, and Arkansas. Those are where you'll find the communities that just are being highly impacted by COVID-19, and with the reality that so many of those places don't have access to Medicaid expansion. There's a reduced access to schooling, reduced access to job opportunities. A lot of people are doing those jobs where there is no such thing as social distancing. They still have to go to work because they are doing what is deemed to be an essential service, delivering food, working in grocery stores. So we're looking at just a growing inflation of the number of people who are impacted within those regions. So this isn't news. And when in the public health field, we talk about what are those factors, those social determinants of health, or later we're going to talk about those social determinants of disease that reduce your life longevity and really are increasing your ability to live a good quality of life. The number one predictor is your zip code. So where you live really impacts your ability to maintain a healthy lifestyle. So when you think about, like, are there parks available in your community? Is there a good grocery store that has nice fruits and vegetables in your neighborhood? When we look at some of the work that was done, like an example of New York City, where they had the fresh fruits and veggies cart, not only did they they were working to reduce obesity in the Bronx and Queens, that they were really trying to do is trying to make sure that people had options that were affordable, that were available to our communities. So one example is is in Boston. In Roxbury, the average life expectancy in, I think, 2016 or 17 was less than 60 years. But if you just drive about 10 miles away to the Back Bay, their life expectancy is 90 years. So that is the same metropolitan area. But the tale of two cities definitely exists, not just in Boston, but you'll find that in cities across the country. Then, of course, as we know, your racial identity also has a major play into what is your life expectancy, where you're looking at Asian Americans having a life expectancy close to 90 years, white Americans around 80 years, and then coming up at the end as Black Americans with our life expectancy being just 75 years. So this sounds familiar. In my field, we speak about HIV, and we know that African Americans are disproportionately impacted by HIV from acquisition and unfortunately morbidity from people who are dying. And then where are people, the majority of people living with HIV, where do they live? They live in the South, with people who don't have access, and they don't have access to treatment. So a lot of this is that same information as to why we have the best practices. We know the skills that need to be implemented, and we just are going to have to implement them in real time. So a lot of this is like that conversation around social determinants of health, or like I call the social determinants of racism. Like, what is your food security? Can you get to that grocery store? What is your housing situation? Are you street involved? Are you bouncing from place to place? Are you living on the streets? We know that 30 to 40% of people in most of our urban centers of the people who have been tested for COVID-19 are testing positive for COVID-19. And we're looking at things like your environmental toxins, which I spoke to before, like everything from, do you have clean drinking water, to are you living near a stack, like a pollution stack that's destroying your air quality. Then access to health insurance, access to education. And then you see that part that says fewer jobs for WFH, that's working from home. So all these conversations about telework, that is for a privileged few of us who have the opportunity to sit like in our homes and do this work, as opposed to being on the streets and being the bus drivers or whatnot, trying to do your job, trying to bring home money for your family because you are an essential employee, but you're really a sacrificial employee. And we have to really move away from that victim blaming of systemic racism. We looked at all of those pieces that are more likely found in our community. And like just this last week, our Surgeon General, who is a Black man, he got on TV and he essentially blamed the Black community for not eating properly, not exercising properly, let alone for the fact that you don't have good food or opportunities to exercise in your community. But that should be something you should overcome, even though you don't have access, which we have, and whether you're on Twitter, whether you're watching the news, the backlash to Dr. Adams has been severe. And the man on the right in the second picture, he's the senator in Louisiana, who is also doing the same thing of looking at how his state is highly impacted, but he's blaming it on the individuals as opposed to the systems that are in place. So with all of that, there are things that we can do, and that's really what this conversation is about, is how are we going to address those short-term and long-term opportunities to really go forward and look at how we're going to address COVID-19, how we can address these systemic issues that are plaguing our community, and how are we going to come out ahead. And those short-term pieces, this is the part where each of you across the country really need to like connect with your local Congress folks to really make sure that CMS, your centers of Medicare and Medicaid, are pushing to the Medicaid waivers to the states to be utilized in an appropriate way. Those Medicaid waivers mean that you can use more money for things like telemedicine, especially if you're in rural Mississippi or rural Georgia. You're able to use things like transportation to get people to the clinic, making sure that individuals have access to PPE, that protective equipment that is necessary for the clinicians to do their work safely. Even the sitting president started having conversations about reopening ACA enrollment to make sure that all the people who are coming in and are not being diagnosed with COVID, but are coming in with flu symptoms, should not feel they don't have COVID when COVID services are covered currently, that they're diagnosed with something else, that they will not be deeper in the hole. So that's where ACA enrollment comes in. And how are we going to get telemedicine out to the community? A lot of things around the COVID-19 response teams. We have people who are actually trained to do this work, who are crisscrossing across the country, but really we want to make sure that they're not just going to New York and parts of New Jersey. We need people going to northern Mississippi, which probably very similar to the work that we're doing to get doctors to work in those areas. We're going to need those surge teams to come to those areas. And some of those smaller things like advocating for removing federal taxes for those sacrificial employees who are earning less than $75,000. If you're making $23,000 a year working at the local grocery store, like at the very least, the federal government can do is remove your federal tax burden. And then we've seen the money that's coming through for the federal stimulus money, but we have seen that money is actually run out. And the organizations that had better working relationships with their banks had access to the money first. And those are quite often PWIs, predominantly white institutions that have access to this money. And we've seen that so many of our organizations haven't been able to get through the system before the money ran out. And I'm very glad to hear that we're going to be having conversations about making sure that each person is being counted, how to complete the census, and then voting. And so I want to say you have to watch this space because it's always been up to us to really drive these conversations around HIV, around COVID-19. It's going to be racial and ethnic minorities. We have to make sure that we're supporting our immigrant communities and undocumented people. Incarcerated people, or looking at how people like nonviolent criminals need to be released from the prisons and the jails as soon as possible, because we know that as COVID-19 is working its way through these prisons and these overcrowded prisons, that there's nothing, that they do not have the capacity to help these individuals. I spoke earlier about our homeless population, and then we can't forget our sex workers who are disproportionately Black African American, who have lost their ability to maintain an income, and we need to make sure that they're supported so that so the crisis doesn't continue. So please stay updated. This is one link. I'll ask Dr. Secure to share this in the chat box that you can go to stay updated on COVID-19 resources. And then also some other references that you can use to dive into some of the other people doing a lot of health policy around this and like have a better understanding of where COVID is. You can always reach out to me via email, which you see there, or via Twitter. You can direct message me or in the normal messaging through Twitter. So we need to make sure that information gets out to every medium possible, because we have to make sure this doesn't just stick in public health and public policy circles. This has to be information for individuals who are being disproportionately impacted, who have nothing to do with these types of webinars, who don't even know these types of things are going on, but we're all working for those populations. Thank you for your time, and if you have any questions, I'm more than happy to respond.
Thank you. Thank you, Ace. We have a Q&A section that people can submit questions that we can take in the last part of this this panel. I appreciate it. And next we will have Dr. Pete Silver. And while Dr. Pete Silver is setting that up, Dr. Pete Silver is going to talk about the impact that COVID has on education, higher education.
Thank you so very much. I'm going to kind of breeze through some data, and I'm going to skip the information that has already been shared by my colleague. I want to go to the higher education piece. One of the things that we have seen is the impact that this virus has had on all sectors of society, and many of our colleagues are going to speak specifically on that. And so I'm not going to take time to deal with that today, but I will talk about the impact on higher education, and then I want to end my comments specifically on how this is impacting our HBCUs. We know that given the short span of time that institutions had to respond, all of our colleges and universities across the country are being impacted by C-19. The operations in terms of day-to-day, the finances, instruction in a huge way, because they really had no time to process this. We had a shift to go to online and working from home, but that in itself has caused some issues that I kind of want to talk about also. My biggest concern has been the impact on quality instruction. And that is one of the reasons has been the lack of uniformity. We have situations where, from an operational standpoint, colleges and universities don't have the bandwidth, some of the smaller ones, some of the under-resourced ones, some of the HBCUs. And as a result of this, students aren't able to do the things that we're doing now with the Zoom platform, sharing information. The digital divide has played a big piece on this whole situation. But the big piece that we think is going to happen, I know it's going to happen actually, is that there are going to be some operational deficit at these colleges and universities for the end of the fiscal year. Normally, in many small colleges, they have to have what we call a line of credit to make it from normally around April, May-ish to September when the revenue comes in again. But they're now having to tap those lines of credit earlier. And of course, the CARES Act provides some resources for them to address the issues of debt, paying faculty, getting online, and what have you. There's also the reality, a lot of people don't want to talk about it, but we're going to put everything on the table, is that some of our older faculty and some of our non-tech faculty are being asked to move online, and they haven't had the proper professional development. I have a friend that's a provost, and they use Blackboard. And so she's been checking in on Fridays to see who among the faculty are online doing the work and what have you. And she said there's a lot of inconsistency, and some people have not even logged on. And that has implications from an accreditation standpoint and from the Department of Education standpoint. This whole issue of the digital divide is really, really hitting us hard because some students don't have the computers, the take-home computers. CARES does provide some money to give directly to students to address this concern. But on some campuses, believe it or not, even though the campuses are closed, some students are still residing on the campus because they have no place to go. And as we look at the enrollment across the board, enrollment for the last 3 years at many institutions have been challenged. But this C-19 virus is going to create a tsunami, if you will, in terms of the enrollment at some of these institutions. Institutions have been trying to create a revision of curriculum because some of our curricular activities are outdated. And as a result of that, they have not been able to roll out these programs. And as a result, what we're seeing is that the campuses are not really involved or engaged in a way that creates a situation where these faculty members can continue to do what they're supposed to be doing. And so when we began to look at this from an operational standpoint, security is still a concern because you have faculty who are coming on campus day to day. You also have a situation in which individuals who are non-essential employees as well as essential employees are still on campus. The other piece is it's a challenge to create supervision on the best of worlds. But in this situation that we're having now, we have a problem with faculty. In other words, the chairs and the deans and the hierarchy supervising each other, if you will. So that has been a huge challenge. So the other piece is that we're seeing that the impact on the financials of institutions is really crazy because the refunds that students are asking for housing, they're also asking refunds for room and board. Institutions are having to pay higher technology costs. Lines of credit and debt are going up. And what everybody should be aware of is that there are going to be severe budget cuts coming in the fall. Some of them have already started in the form of frozen positions, furloughs, and layoffs, the whole 9 yards. But the cash flow at institutions is being challenged. And this pandemic has hurt the financials, so the endowment is down and the bond ratings are down. And as a result of that, institutions who are on the margin are going to have some real issues. Now, from an accreditation standpoint, folks are saying that this would have an impact, but the accreditors are actually working with the institutions to make sure that they can get through this pandemic. They're delaying decision times. They have allowed them to have a substantive change for technology. They are looking at how they can reduce the academic calendar and giving them additional times to turn in documents. But the bottom line is that those institutions that were on the margin are going to have really severe issues. What the accreditors are saying is that if you had financial problems before the pandemic, then you can't blame the pandemic on your overall financial position. It may impact it in a negative way, but if you were having problems before and you're still having problems, that's going to be symptomatic. When we look at this whole impact on higher education, state revenues have been challenged anyway. Higher education has not been getting its fair share of resources from the state. The last 10 to 15 years, the resources have been down. And if in fact we do go into a recession, which is a possibility, it's going to be more impactful. And so as we see this, we know that a lot of money that is now being focused in higher education is going to be shifted to healthcare. And that's what it should be doing across the board. But my point is that the revenue is not going to be there for higher education. That's for state schools. And then for private schools, just trying to find the resources. Those friends have been giving you money, those foundations, those corporations, their money is going to be down because of the impact on the endowment and the stock market. So therefore, there's not going to be monies available for many of these institutions to receive money from these people. And so the other thing is that already Moody has downgraded the credit outlook for higher education from stable to negative. And so that simply means that money is going to be harder to come by. The borrowing power is going to be really tough to engage in. And so as a result, those institutions that's on the margin will have severe problems. There is a discussion, and some of us have heard this discussion, maybe it's time to think about an articulation or partnership between institutions. I think it's time to have those discussions. In some cases, there are those who say that maybe some of the institutions should merge or consolidate or close. I think the discussion is worth having, but I think that the real barometer for those kinds of discussions will be and should be the impact that this situation has on student learning and learning outcomes. And if we have institutions who are having severe financial problems and it's impacting the ability to sustain their core mission, and that is teaching and learning, then I think those discussions should be on the table. As many of you know, institutions, students, faculty were on spring break, many of them, and they got the word that spring break is going to be extended. And they really couldn't understand, is this real or is this a joke? But it's real. And so many of the folk didn't even have a chance to go back to the campus to separate from the campus in a more effective way. And so it's been a logistical challenge for students. It's going to be an issue for the senior class in terms of a psychological and mental health perspective as they're trying to find jobs. But more importantly, students who've had problems trying to navigate higher education anyway, it is now going to be even more of an issue because the gap money that they were making in part-time jobs and family incomes, I mean, family people are losing their jobs, the students have lost their jobs, so that gap is going to be even wider. The other thing is that non-traditional students who are going to have to make hard decisions coming up because as they're in school, their children are home with them, they lost their jobs, what's going to happen? The other piece is the whole international students. What is being done to them or for them? They couldn't fly home. They didn't have a place to go in many cases, and a lot of them are still on campuses. And it is a situation that has to be addressed. I'm also looking at the social behavior of students, the good and the bad. We saw a lot of the students who have defied the social distancing and they are gathering on beaches and in other public places. And there's a concern about what does that mean for their overall health. The big issue is going to be how do we document learning during this pandemic? Many of the institutions have asked their accrediting agencies to move from pass-fail. That has occurred. The question becomes, what does that mean in terms of really documenting learning? The other thing is faculty and staff have, of course, not been able to participate in professional development. They are concerned about the issues that will stress them out later on, and will I have a job when this is over? Will my students come back? And so those are issues that we're going to have to look at. And then I'm going to stop and then make sure that we have time for question and answers. And this is basically what I was talking about earlier in terms of the impact on higher education from the accrediting standpoint. And a lot of people are concerned about our HBCUs. Our HBCUs are going to be fine if, in fact, they have the protocol on campuses to address this issue in real time. But a lot of them are strapped with cash. A lot of them do not have some of the bandwidth in online programs. If you look at the percentage of all institutions that had completely the bandwidth and the access and the technology to do online program, I think it was about 75% across the country. But when you begin to look at that 25%, it is small colleges and HBCUs in some cases. I think you should take a good look at the CARES Act in terms of some of the relief efforts that have been going on, because the federal government has made $2 trillion available for relief, and $14 billion of that is going to colleges and universities to address this issue on going online, food, housing, technology, and it's going to be divided on a Pell Grant basis. But what I'm hearing from my colleague presidents, they're saying that the money is not getting to the campus fast enough, and that it's a big breakdown in moving from the banks to the campus, from the federal government to the banks to the campus. But there have been work study waivers for the institution does not have to have the match again. They've been relaxing the return to Title IV. If students are withdrawing because of the virus, then they're relaxing that return of the money back to the institutions. So let me just kind of stop here, and hopefully there will be some question and answers that I can deal with them as that time come along. But giving respect to my colleagues who are on the panel, I'll stop right here, and then hopefully we can pick up some of this information when my time is on the table for question and answers. Thank you very much.
Okay. Thank you, Dr. Silver. Greatly appreciate it. Next, we will have Dr. Fred McBride from the Lawyers Committee for Civil Rights Under Law.
Thank you very much, Dr. Franklin. And on behalf of the Lawyers Committee for Civil Rights Under Law, I'd like to thank NCOBPS for inviting me. I'm going to try to be brief while I go through a discussion about the 2020 census. I want to start with the Lawyers Committee for Civil Rights Under Law was founded in 1963 at the request of John F. Kennedy to enlist the private bar to address the civil rights of African Americans and people of color and move that struggle from the streets to the courts. The census is a civil rights issue. It affects political representation, and the census began as a civil rights issue, as we know from the 3/5 compromise all the way to 2010 and now with an undercount of people of color. It is a civil rights issue. We don't have to discuss, and we don't have time to discuss, and I want in the interest of time, political representation. Our apportionment and our redistricting is based on an accurate count. But for purposes of this seminar, let's talk about money. In 2020, we're talking about some $880 billion yearly for federal funding, schools, roads, public services. Since we are focusing on this intersection between policy and the COVID-19 crisis, this is what we need to talk about and how important the census is. I won't go through some of the things the other presenters and particularly Mr. Robinson discussed. I don't have to tell you the disparities that exist between people of color and other individuals. None of us were really surprised. I don't think we were surprised to hear that Black people were disproportionately affected by COVID-19. We know our health situation in our communities. We know about schools. We know about food and housing insecurities. We've always known about this and we've always addressed it. So I don't think that that is new. What we need to do is get counted. We need to fill out that census form because now moving forward and on the other side of this COVID-19 crisis, we've got to address or continue to address, because it's not the first time we've had this in front of us. We've got to continue to address this disparity and the inequities that exist. Our elected officials, from mayors, state representatives, and our federal members, we're going to need funding. We're going to need this $880 billion a year to address some things that COVID-19 has highlighted. We all knew about our communities, but a lot of other people just didn't know or they did not pay enough attention. And this is important because, as you can see on this graph, from 1940 all the way to 2010, you see an undercount of Black individuals. You see that undercount. And don't be impressed that from 1940, we went from a negative 8.4 in 2010, oh, we did great, to negative 2.5. That is still not great. That is not great because that net undercount, and that's net undercount, that is over 850,000 people. What actually happened in 2010 was 3.7 million people, Black alone or in combination, were missed in the 2010 census. What does that mean when we are missed? That means that that community that needs more healthcare facilities, that school that needs more programs, all of this is impacted when we are missed. So we must get counted. And when we talk about this Black alone number, we see that children under the age of 5 are the most undercounted. And that's across all race and ethnicities. All race and ethnicities. But if you look at the Black alone number, go to the middle of the graph. Between the ages of 25 all the way to 54 and above, those are significant numbers of Black people that are missed every census. They are missed, and our communities suffer when we're not getting the requisite number of dollars that our communities deserve. And within this within the Black community, it's mostly Black males that are missed, more Black males than females that are missed. So we've got to address this undercount. And with the COVID-19 crisis, we are still, the Lawyers Committee and a number of other organizations, we haven't stopped because we are in our homes. I'm in my home right now. I've been for the last 6 weeks stuck, but I was happy to do this webinar, and so were other individuals on this. We are still engaging through social media, through the internet, through radio and PSAs, all of this, we are still trying to reach the undercounted community because this census is important. And in our messaging going forward, you know how we say each one teach one? Each one call one and ask them, have you filled out that census form? Paper questionnaires have been mailed now to anyone that hasn't responded. So in our messaging, let's encourage people to continue to exercise health and safety. Let's tell people you may have a paper questionnaire, you can still do it online, you can still call the Census Bureau. They are revamping their callback feature now. And if you got that paper questionnaire, mail it back. We have got to get counted. And resources. We are still doing whatever we can. All we can do now is try to reach you by phone, by social media, Facebook, Twitter, just continuing to basically bother you to fill out that form. I do want to mention before I close the mapping application. They call it the hard to count mapping application. I say historically undercount because civil rights community, we don't believe we're hard to count. We believe the Census Bureau and the federal government has not invested enough to count us. So I'll call it the historically undercounted community mapping application. Go to that and you can see how your state, your city, your county is doing in terms of responding to the census. That's important. I want to emphasize hotline. The Lawyers Committee has a hotline, 888-COUNT-20, where we will answer any census questions. Do I have to put my grandchildren on the census form? Must I be a citizen? No, you do not. But if there's a question or you know someone that has a question, call our 888-COUNT-20 number, and then we're partnering with other organizations that are doing the hotline in different languages. And when we get on the other side of this, and we will, and we go back out to communities, we may be doing a lot of things virtually now because the world has changed, but when we get there, or if we can go out, or if you are doing things, or if you want a ton of material to mail to your church members or your civic organization members or people you would reach if we could do face-to-face interaction, please copy this URL here, www.tinyurl.com/census materials. We will mail you whatever you need to get out. And if you need to mail it to other people, that's fine. We'll mail it to you to mail to them, because it is important that we count everyone. So with that note, I'm going to close out to allow time for other presentations. Thank you, Dr. Franklin.
Thank you. Thank you. We have 2 more presentations in this panel. We have some questions. If we don't get to the questions, we'll ask the panelists to type up the answers, and we'll email each of the registrants those answers, since we have an email address, and we'll post those answers also on Facebook and connect it through our Twitter feed as well. We want to make sure we leave enough time for Q&A. So right now, just to do a time check, it is 3:55 p.m. Eastern, 2:55 p.m. Central. So we want to make sure we leave about 15 to 20 minutes or so for Q&A. Next, we will have Ty Rush from the UCLA Voting Rights Project, talking about voter access.
Hi, everyone. So I'm going to try to keep this as brief as possible. My name's Ty. I'm from the Voting Rights Project at UCLA. And during this COVID crisis, we put out a series of memos and things like that, reports, documents from legal experts, social scientists, and from medical experts themselves. And so I encourage you to use those resources. I'll try to get through as much as I can with a focus on how this is going to affect the vote in November, this November, in a pandemic. So it's clear that this pandemic is bad, but epidemiologists are forecasting another outbreak, a second wave. We don't know how bad it could be, but they're predicting that for fall, which is when the election will be held. So safeguards need to be put in place, because if an outbreak does occur, and it looks like what we're expecting, then social distancing, crowd avoidance, quarantining, things like that we see implemented now will be vital to keeping the spread held back. And so the virus spreads most easily through human contact. It can occur through contaminated surfaces, touching them, but primarily it's spread through respiratory droplets that come in contact with people. And it can spread when people touch things like, plastic, cardboard, glass, things like that have been contaminated. And this is particularly a problem if you're trying to hold an election, because it basically presents this ultimatum where people have to pick between their safety or casting a vote and being counted. And that's an issue. So it jeopardizes voters, because many voters are taking public transit, rideshare, things like that, which directly conflict with social distancing recommendations. They're waiting in lines. They're using the same machines and ballot marking devices, things like that can cause contamination. And we're subjecting poll workers to this too, because they're exposed to voters throughout the day. And poll workers in general tend to be older, retired, so they're a demographic at risk of fatality and severe symptoms if infected. So an example of this, we just had a primary in Wisconsin happen, where you guys might have heard about this, but in Florida earlier this year held a primary, and 2 poll workers in Broward County actually tested positive for COVID-19. And the problem with this is one of the workers was responsible for verifying identification. So he's handling driver's licenses, plastic surfaces like you'd find in a driver's license. And that's something that could be contaminated. Imagine how many people's licenses that they touched that day. That's a huge problem. We want to make voting safe by moving more towards this vote by mail option. So let's talk about that. It's safe. It's a safe alternative to voting in person, because face-to-face contact is usually how this thing spreads. And it's very unlikely that it'll spread through paper, cardboard, or other surfaces like that. But it's also a greater chance of spreading human to human. So we're just reducing the risk. So there's no evidence that COVID-19 has spread through mail, The USPS actually put out a report on this that's very detailed, where they say, where they kind of address this. And there's a quote I want to read you. It's because of the poor survivability of these coronaviruses on surfaces, there's very likely low risk of spread from products or packaging that are shipped over a period of days or weeks at ambient temperatures. So there is science behind this saying that mail is safe. And again, we have a report out on that. So if you guys want to look us up on the internet and read that, there's more details there. But it's additionally safe because postal workers have ceased physical contact with customers, and the processes that they obtain signatures, things like that, have moved to account for those social distancing protocols. They're implementing things like improved hygiene. They're frequently disinfecting workspaces. And we've seen before that the Postal Service has actually developed plans of preparedness for these circumstances. So in the 2001 anthrax scare, they've developed protocol to go through and avoid contaminating employees and customers and kind of neutralizing that threat. Since 2005, too, they have especially developed an emergency plan for pandemic influenza, like we're seeing right now with COVID-19. There are certain practices that they initiate for getting mail to federal offices, and that's ionizing radiation and using UV light radiation to sanitize mail that's delivered to these agencies. So the infrastructure for that already exists, but let's move on to vote by mail. So one of the benefits with this is we already have the infrastructure to do the all-mail elections that we are trying to move to because they're safer. So about half of all states have some law on the book that call for all-mail elections in special circumstances and jurisdictions. 5 states already conduct their elections exclusively by mail, and 33 others have no excuse. They offer no excuse absentee mail ballots that anyone can request at any time for any reason. Other states have also began experimenting with things like vote by mail, but looking back at 2016, about 23% of all Americans voted through mail. So that's an alarming, that's a staggering statistic. We have the infrastructure in place to do this effectively. So let's go through some of the benefits of moving elections to mail for this pandemic crisis. We've seen that from researchers doing data analysis on elections that it increases turnout, with an emphasis on groups like Black people, Latino voters, young people, etc. So increasing turnout among these groups at a time like this is important to note as a benefit. But overall, it does increase turnout when we don't look at the breakdown. There's less down ballot roll off, which is, you get a ballot, you see you're voting for president. By the time you get to the end of the ballot, you're voting for things like school board, water board, things like that you may not have as much exposure to. So more people are in information environments where they can vote for those offices informed with mail. It's more secure than the voting machines that we currently use. It's secure from digital hacking, and it leaves a paper trail. And as long as there's a ballot tracking system in place, which some states do, it makes it pretty secure. It doesn't require face-to-face interaction to vote, and that's going to be key for something like a pandemic environment. And there's significant savings in transitioning to vote by mail because we've had things like staffing costs, voting machine purchases, etc. So I'm going to run through a few things and then kind of skip over to what I think is most relevant for this conversation. So as long as vote by mail is administered in a responsible way, it doesn't cause disparate impacts for certain groups, but in its current form, we have to be aware of those things that can impact poor, Black people, Latinos, things like that, if implemented poorly. One example is screening out rightful ballots. That's something that currently happens at alarming rates, especially for Black people. In Gwinnett County, Georgia, in 2018, about a third, something like, where is it? Okay, a third of all ballots that came out of Georgia that were rejected came from Gwinnett County, which, if you're paying attention, it's a pretty racially diverse county, and that's a huge problem because that's hitting people of color, that's hitting Black people more. There isn't the same level of trust in the delivery of mail services for vote by mail as we would need. Some people are afraid that if they put their ballot in the mail, it's going to get lost, it's not going to get to the elections offices in time, that sort of thing. So we need to offer things like drop box locations where someone can drive to a box and then just drop their ballot, and it's directly handed, or it gets in the direct possession of elections officials. I'm going to go through a couple of workable minimums that we need to do to convert some of these elections to being safer for Americans to vote. We need to establish no excuse absentee ballots. What that means is we can't ask voters why they need an absentee ballot. We're in a pandemic. They shouldn't have to pick between their safety, the safety of their families, and casting a ballot. Postage must be paid. We can't be charging people to send out their ballots. That's a disparate impact on people who are poor, who tend to be Democrats, Latinos, Black people, and other groups. But moving on to something that's key is the signature matching fair ballot verification process. So this is something that has been used to reject vote by mail ballots at a high rate. We need to have an alternative process in case your signature doesn't match to verify your identity. And in order to do that, we need to have some in-person curing by voters that needs to happen over the course of 14 days after an election, so that if your ballot does get rejected and you can track it, that you can go in and cast your ballot, verify your identity, things like that, so that your vote is still counted and still matters. There are cries, there have been cries recently of voter fraud and things like that, and the takeaways here are just, it's extremely rare, it is detectable and heavily penalized, and typically it's somebody helping a friend, a family member with a ballot, and then they don't sign it as well. So it's just a lack of clarity in what these absentee laws are, what people are required to do. It carries a 5-year prison sentence and a $10,000 federal fine in addition to state penalties per fraudulent ballot. It's not something that has ever tipped an election one way or the other. It's just the penalties are too high, and agencies have stepped in, and states have stepped in with anti-ballot harvesting and other protocol to detect and penalize it. Thank you.
Thank you, Ty. One quick question, one quick concern of the panelists. People are asking questions. You can also answer questions live, which could save a lot of time. But next we will, our last panelist for this session, and then we'll have a short Q&A. But again, the panelists can answer questions live, is Princess Williams, who will talk about the impact of COVID on Black rural communities. Princess, are you there? Okay.
You need to unmute.
She's on mute. Princess, you may want to unmute your video, your sound, and your video. Okay.
Yeah.
Okay, so good afternoon, everyone. I first wanted to thank NCOBPS for organizing such an important town hall, given the impact of COVID-19 on Black communities. So my presentation will broadly focus on the state of Black rural communities during the current pandemic. And so first, just give you some descriptives about the geography of Black America. 92% of Black Americans living in rural areas actually live in the American South, as someone stated earlier. Mississippi has the largest Black rural population, with nearly 40% of Blacks who live in the state living in rural areas, and also 30% of African Americans in the country actually live in non-metropolitan areas. And as it relates to the impact of the pandemic on African Americans, we have seen that Black Americans are disproportionately dying from COVID in most states. And as it relates to Black rural Americans, they are particularly at risk of dying from COVID-19 for several reasons relating to structural inequality. For example, according to the United States Census Bureau, we see that Black rural Americans experience the highest level of poverty. They experience the lowest level, the lowest income levels, and they also experience health disparities at disproportionate rates. And given this enduring impact of racial inequality in America, I just wanted to discuss some of the structural factors that make Black rural voters even more vulnerable during this pandemic. And here's analysis. This map is an analysis from the Sergo Foundation that suggests that Black rural Americans are more vulnerable during this time, and indeed less likely to withstand the impact of a widespread coronavirus outbreak in their towns and in their communities. And some of the structural issues that make African Americans more vulnerable during this pandemic include a number of things. First, majority of Southern states are right-to-work states. Additionally, rural Blacks are more likely to be low-wage workers and more likely to work in jobs that are deemed essential during the pandemic, as someone stated earlier. And they are less likely to receive sick and late sick leave or paid leave during layoffs. And secondly, only 3 Southern states expanded Medicaid, a part of the Affordable Health Care Act. And as a result, Southern states have the highest uninsured rates. So if someone were to contract the virus, they're less likely to be able to afford treatment, and some are even less likely to seek medical attention. And lastly, rural areas have limited access to hospitals due to shutdowns and low state funding, which makes it more costly and difficult to receive medical attention if residents contract the virus or if there is a massive outbreak in the community. In Black rural America, it's indeed a story of struggle and resilience. While preparing this presentation, since I study public opinion, I searched social media for sentiments from Black rural Americans, and I saw a couple comments in particular that convey a message that what we perceive as a pandemic for middle class white people is everyday life for some rural Black communities. For many decades, these communities have been plagued with challenges such as environmental racism, food insecurity, limited assistance during natural disasters, persistent poverty and inequality, low opportunity structures. And essentially, they feel that they've been social distant from the country for a while. So given these sentiments, they have always had to find strategies to survive under conservative state governments and intense state oppression. And so many rural communities, I've seen many reports of rural communities doing a number of things to survive during this pandemic. For example, you have local businesses who are also struggling, donating food and toiletries, during this pandemic. You have community service organizations and churches who are also donating monetary rewards to families and helping assist poor families during the current pandemic. You have advocacy organizations who are donating money to local businesses and families. And also you have political leadership who are actually leading in a lot of these southern states and forcing state governments to take on stronger restrictions, social distancing restrictions. But a lot of these communities have taken on the role to help themselves out, given the lack of response from the state governments. And so these are just a couple of maps that show that southern state governments have implemented policies over time that have actually advance inequality and health disparities in rural America. And so I have just came up with a couple of recommendations that could help a lot of these communities. First, raising the minimum wage, which will help a lot of these low wage workers, increasing worker rights for a lot of these communities, also expanding Medicare to a lot of these communities, because a lot of, like I said earlier, a lot of these communities face a lot of high uninsured rates. And lastly, finding federal funding for rural hospitals and healthcare centers. And also, I have a list of things that academics and scholars alike could do to help these communities. NCOBPS, we're working with, we have this Black Rural Project that we're doing to help Black rural voters in Selma, Alabama. And a lot of the voters, they talked about researchers and scholars coming to their communities to scare us to study them and not giving back or not finding ways to share their research with them, or just giving them, you know, following up after we come and interview and get our data from them. And so one recommendation I have is we actually become policy entrepreneurs or public scholars, finding ways to share our research with public officials as well as with the community. Second, remember the rural South post-pandemic. A lot of these issues that they're facing have been going on for a long time. So don't forget about them after all of this is over. And lastly, finding increasing donations to local advocacy and community organizations. A lot of these organizations have been in the community before the pandemic, and they will be after. So I have provided a list of organizations that you all could maybe screenshot, take a picture to donate money because they need it now. We don't know how long this pandemic is going to last, but increasing funding for these organizations will help them a lot. Thank you, and I look forward to any questions.
Thank you, Princess. Greatly appreciate that. So in this part of the segment, we have about 10 minutes left, and again, I want to emphasize to the panelists that there's a list of questions in the Q&A that you can answer. I'll pull out several questions from the Q&A, but before I do that, 2 requests from the audience. If you have a Twitter handle, if you have a Twitter handle, can you repeat your Twitter handle so the audience can get a hold of it? And if you're willing to share your presentations, if you could email that to me, I can put it in a Google Doc and send it to the registrants for this town hall. So those are 2 requests. So for those of you who have Twitter handles, if you answer the questions, just mention your Twitter handle. And then for those of you who haven't answered the question, then we'll do that before we conclude. One of the questions that came up for Dr. Silver, and if we could just take 1 minute, a 1 minute answer, is a combination of questions. What are universities going to do with disappearing students? And are there any good examples of HBCUs that are mitigating the impact of COVID-19? So we'll start with you, Dr. Silver, and then we'll go with the others.
Thank you, good sir. One of the concerns has been that because students are disappearing, we're using that in quotation marks, it's going to be incumbent upon the institution to document that they participated in a learning process during this C-19. The consequences could be detrimental to the institutions, because the State Department of Education is saying that if you cannot document the learning, then you will forfeit the semester. And that has all kinds of implications. So I think what is going to happen is that the institutions are going to have to use their resources, the electronic resources that they have on file, to try to track these students down, but more importantly, to try to document that they've actually been in the queue so far as classrooms are concerned. If not, they're going to have to use the Title IV withdrawing and to withdraw them early on, because there is a part of the CARES Act that says if a student withdraws from the university as a direct result of C-19, then they will not have to, meaning the institution will not have to return those funds back to the Department of Education. So I think it's going to be very incumbent upon institutions maybe to even use their recruiting staff and the faculty to try to track those students down, because it will have financial implications. Institutions that are doing well, or at least have pivoted real well, one that I point to is Tennessee State. Tennessee State University, I think the president there jumped on this really quickly. They have had, I think, good response from their faculty. They have had good response from the administration. And that's one institution that I would hold up as a good example.
Okay, thank you. The next question I'll pose to Ty Rush, Fred McBride, and Princess Williams. I'm gonna do a combo question, which is the general idea of trust, the trust in vote by mail, given that most individuals and many individuals, particularly in the South, are used to voting in person. And along those lines, Fred and Princess, trust in the census now, given that you've had in these kind of quote unquote hard to reach communities, given COVID-19, and for Princess, how do you think that's going to play itself out in the rural South, especially given your recent work in the Black Belt counties of Alabama?
I'll start briefly. The no excuse absentee ballot, vote by mail has been effective with Blacks and voting ever since we started it. And even going back to President Obama's election and thereafter, you saw attempts by many jurisdictions and states to not only stop this, but eliminate the time period. And it's been successful thus far. So there are severe consequences for individuals who attempt to incorrectly identify themselves when voting. We can let the law take care of that, but we should not adhere to media and outcry that there is so much fraud in it, because honestly, we can't find the fraud, and I have been looking for over 20 years. Now, for the census question, Title 13 assures confidentiality. Your information cannot be shared with other government agencies. Even the census official, if you call and give that information on the phone, is subject to fine and or imprisonment. So we're going to have to trust Title 13, and I'm going to ask you to trust organizations that will go after government and other officials who abuse that trust.
Ty?
Yeah, I just wanted to pop in and say a couple of things from our report. So Oregon is by no means a Black state, but they do have anti-federal and anti-state government militia groups. And so there's a deep distrust of government in general. They're a vote-by-mail state. They've been that way since the 90s. And one way to address this was to offer these drop box ballot locations at public buildings where voters can come in with their sealed ballot, drop it off, and know that it got to that election source. And having a barcode on it that they can track online, their serial number that they can track to make sure that that gets counted, is something that we could do to curb that mistrust. But the problem is, at the beginning of implementing vote by mail, it's mainly something that people need to experience in order to gain trust from. And like, how do you do that without trusting? It's kind of circular, but it is going to count on organizations and trusted groups, trusted officials to get this information out there, to build campaigns of trust. And it's not a hard lift, because primarily in the South, Black voters have been using things other than election day voting. So early voting, other things like that. So just like curbing them away from that and into this safer vote by mail isn't as big a lift as we're planning.
Okay, Princess?
Yeah, I agree with Ty. For rural communities, it will be a little bit more tricky, given how far some use post boxes and other forms to go to like the actual post office to get their mails and things like that. So it'll be a little bit more tricky. But one thing that we know about Black rural communities and Black communities in general in the South is if you look at 2016 data, they actually turned out at very high rates, actually, compared to some other states. In a lot of these other, and it's as a result of a lot of organizations within the communities, churches and other Black institutions that have pushed the issue and discussed the importance of voting. So I agree with what everyone else said, that, you know, we need these other organizations. We need people on the ground to make sure that they're informed on the issues and informed on the process.
Okay, thank you. And my last question, and we have about 1 or 2 minutes, is for Ace. And it's a if Ace is still with us, I think yes. There you go. It's a larger question, which is the impact that the attacks on Obamacare had on the ability of African Americans to get access to the vote. And I'm going to link that question hopefully to another issue, which is what we saw with Hurricane Katrina, which was major racial disparities and trauma emerging from that particular crisis. So if you can maybe answer those two questions together, greatly appreciate it.
Simple answer. So we're looking at what they say, like what they did in Kentucky and Louisiana. The big push with the state senators and the governors, and being very clear that they needed to make sure that this was going to be an issue in their election. That was where Louisiana moved to a non-veto proof legislature, Republican legislature, and also not only had a Democratic governor elected, but reelected. The real big focus was making sure that healthcare access was clear and like addressing healthcare disparities. So when you're looking at the reduction in healthcare disparities for Black versus other populations in Louisiana and Kentucky, that comes pre and post Medicaid expansion access. The data is clear. We also found the same in Maryland and Virginia, and we're looking at how are we going to address those issues that relate to health disparity and healthcare access. With what came after in 2005, after Katrina in Louisiana, Mississippi, we were able to see like what we already knew anecdotally, that the data was overwhelming, that individuals who did not have access to health insurance did not seek health care, even when they had or even when they were starting to self-identify modalities with themselves, like, you know, whether you're talking about infections, whether you're talking about some loss of nutrition, TPN, total perinatal nutrition. There are a lot of issues that were coming to the forefront that they were really trying to address. Through Louisiana State did a great job. Through Louisiana State University, of their medical system, they really tried to refocus their healthcare services in the lower in the wards. The same with Tulane doing a lot of refocusing. Mississippi did not do as great of a job with trying to support the folks in the Bayou region, but we have seen like the data, following the data shows that people who have access to healthcare do better. But then that's very, from a public health way of speaking, very downstream. The upstream conversation is going to be related to food security and built environment, related to like parks and walkability of your neighborhoods. Those are the things that really lay down whether or not you're going to develop diabetes, hypertension, and some of those other issues that you do not want to deal with if you can prevent them, because prevention is always worth much better than treatment itself.
Okay, thank you. I greatly appreciate this first panel. I want to emphasize that if you can, as panelists, look into the Q&A portal and answer questions that have yet to be answered, including if you have a Twitter account, please submit your Twitter handle, or you can email me the Twitter handle, and before the town hall ends, I'll input it myself, or I'll write it in myself. So we want to greatly appreciate you. We're going to transition to the next panel in about 5 minutes. Again, we want to thank for this panel, Dr. Fred McBride, Princess Williams, Ty Rush, Dr. Pete Silver, and Ace Robinson for their commentary. And I'll follow up with you to see if we can get a hold of those slides that some people are asking for. And for our audience out there, if you can hold on for 5 minutes, we're going to transition to the next panel. And for our Facebook Live feed, at times it appears that the Facebook Live is going in and out. So I'm going to try to make some adjustments. So we'll reconvene in about 5 minutes. Okay, we're back, and we're going to get started. We still have quite a few people with us. And again, we're broadcasting this on Facebook Live. At times, for those of you who are on Facebook Live, at times we have to reset that device. And so we're going to get started. And I want to introduce the moderator for this section of the panel of the town hall, and then I'm going to introduce each panelist and then turn it over to our moderator who's going to moderate an interactive discussion with the panelists once they conclude. So again, our moderator is Dr. Kalila Brown Dean, a professor at Quinnipiac University and the author of Identity Politics in the United States, who's also known as a scholar activist around the country. And she's going to moderate this section of the panel. We also have for this panel, Dr. Keisha Middlemass, and she is an associate professor of political science at Howard University and is one of the foremost experts on prison reentry and the politics of punishment. She's the author of Convicted and Condemned, The Politics and Policies of Prison Reentry. I encourage everyone to get that book. She is also researching food insecurity in the returning prison population and has also worked for the Vera Institute of Justice in New York City. We have Dr. Andrea Benjamin as another panelist. She's an associate professor in the Clara Luper Department of African and African American Studies at the University of Oklahoma. Her work focuses on coalition building and electoral representation, particularly in cities. She's the author of Racial Coalition Building in Local Elections, Elite Cues, and Cross-Ethnic Voting, and also works with Sally's List in Oklahoma. Following her is Dr. Lakita, excuse us, my apologies about the misspelling of the name, Lakita Bonnette-Bailey. She's an associate professor at Georgia State University in the Political Science Department. Her research interests include popular culture, political behavior, Black women in politics, political attitudes, and African American politics. She's the author of the book, The Pulse of the People, Political Rap Music and Black Politics, and is one of the country's foremost experts on the politics of hip hop. We also have Dr. Jonathan Collins. He's an assistant professor of education at Brown University. His research interests center on questions of racial and ethnic minority political behavior, democratic governance, local and urban politics, and public policy. He focuses particularly on education policy, including education and finance, urban school reform, urban school governments, and child care policy, and is known as a person who really focuses on public schools. We also have Dr. Jamila Michener. She's an assistant professor in the Department of Government at Cornell University. Her research focuses on poverty, racial inequality, and public policy in the United States. She's an expert on federalism and Medicaid. She wrote a book called Fragmented Democracy, Medicaid, Federalism, and Unequal Politics. Her new research looks at the determinants and consequences of unequal access to civil representation for low-income Americans and how the lack of access to civil justice can deepen poverty. And finally, we have Dr. Ray Block, who is an associate professor of political science and African American studies at Penn State University. He focuses on racial, ethnic, and gender differences in civic involvement, political behavior, social identity, and campaigns and elections. He also is an analyst for the African American Research Collaborative and Latino Decisions, and is a co-author of Losing Power, Americans, African Americans, and Racial Polarization in Tennessee Politics. So we will turn the town hall over to Dr. Kalila Brown. Did you want to say anything? Or do you want to turn over to the panelists?
I will go. I will just say thank you, Dr. Franklin. And I want to thank everyone who is participating in this town hall as a panelist, as an attendee. We know that the challenges facing this country and really this world are tremendous. And what we also know is that when we talk about the impact of COVID-19 on African American communities, We are talking about a long-standing challenge and struggle to make visible those challenges that too often are rendered invisible or unimportant. And so you're going to hear from scholars whose work directly impact what we are trying to do in order to form this more perfect union, to elevate these concerns and to understand how many of these challenges are so nested. And so I'm excited to hear from them. I'm excited to hear from you, our attendees, because what we hope will happen is that as you walk away from this town hall, you won't be overwhelmed by the information, but you will be convicted and encouraged to take action, because that's what we want to do with our scholarship, to lay a foundation, because we know the public square has become so polluted by ego and by ideology. We want to focus on action and scholarship in action. And so our first panelist is Dr. Keisha Middlemass from Howard University, and she'll talk about the challenges facing incarcerated persons and their families. Dr. Middlemass, please.
Thank you very much for spearheading this town hall meeting. It is a great opportunity to talk about a critical issue, particularly prisoner reentry, because reentry, of course, is connected to what happens inside prison. So if we think about the different jails and prison systems at the local level, state level, federal level, they right now are creating their own set of policies to release men and women who are currently incarcerated. And this move to release people is all because of COVID-19. And why are they doing this? Is because of the very way that prisons are built. You cannot social distance in prison. Prisons are breeding grounds for disease, which we heard earlier on the earlier panel. But you also have to think about the idea that prisons also house large number of people with chronic diseases and multifaceted medical needs. So they are automatically vulnerable to COVID-19, but they're also susceptible to other infectious diseases because of just how prisons are structured. So you think about the lack of space, overcrowding, the under-resourced, and in many ways, the primitive healthcare services that are provided to incarcerated individuals. Prisoners are not allowed to bathe every day. They may not be able to wash their hands multiple times a day for 20 seconds with soap, because in some prisons, individuals have to buy their own soap. They have to buy their own toiletries. They have to buy toilet paper. They get a minimal amount, and once that's out, they got to buy their own. So then you start thinking about just general poor sanitation in a prison, and this is a breeding ground for COVID-19. So what's going on in terms of policy right now is that states and the federal government are taking a multi-pronged approach to releasing prisoners because of what I just described. Now, some of these programs are agreed on between district attorneys and legal aid societies, public defenders' offices, but they're releasing individuals that are awaiting trial, they've been charged but have not been sentenced. They have low-level felony offenses, they're nonviolent offenders, prisoners over the age of 55, pregnant prisoners, those with pre-existing medical conditions. And some of these releases are also because of judicial edicts. Literally, the courts are demanding that people who are locked up because of parole and probation, that they be released. Executive orders signed by governors are waiving some of the requirements for release. And some jurisdictions are trying to slow down the prison admission process to reduce the risk of the transmission of COVID-19. There are maps that are available online that show that not all 50 states, but there are 32 states right now with COVID-19 patients inside prison. And we know that because of the prison system, COVID-19 will just spread like wildfire, and it will not be reduced just because of the structure of how prisons are built. So this release process is taking place in an ad hoc fashion. There's no set of common variables. And when you start thinking about what goes on in prison comes home, the challenge is, where do people return to? So the hardest issue that must be addressed, if someone is being released from prison right now, the standard or the set of policies that we wish or hope is implemented is that a returning citizen would be quarantined for 14 days prior to then returning to the society, returning to the community. But the challenge is, where do you quarantine a returning citizen? Some prison systems are identifying potential places because of the hotel industries have been shut down. So could they quarantine at a hotel? These then living situations must be approved by the Department of Corrections. But then it's also a reentry challenge, particularly for prisoners that are currently incarcerated and then will be released, is their access to healthcare. Healthcare inside prison is bad on a good day. And so it's hard enough to access quality care inside. And then the idea is, if they're being released underneath these ad hoc systems, will they be able to access healthcare once they're out? What is that handoff going to look like between systems? I know, talking to several individuals that are in the reentry spaces in New York, in Newark, in Chicago, that they are scrambling to figure out how to address multiple issues for literally hundreds of people that are going to be coming home. And when I say multiple issues, it's COVID-19. Is someone actually infected with it? Have they been around somebody? So where are they going to quarantine? But also, can you get the tests at the local level? That is still a challenge, where Department of Corrections don't even have the ability to test everybody that they're now being asked to release. What about the mental health and well-being of individuals? We know employment right now is awful, or unemployment is high, so the access to actual employment services or employment and possible jobs is really low. What about family reunification? I'm not disagreeing that releases should take place. I'm just now asking the question is, where are people going to be released to? And will they be able to access the services that are critically needed for them to be able to re-enter and re-enter successfully?
Thank you.
Dr. Benjamin from the University of Oklahoma, please. Thank you, Dr. Middlemass.
I can't share my screen. Okay. All right, y'all. Thanks for having me. Thank you to everyone for organizing this. I don't want to be in this presenter view. Sorry. Anyway, here's my Twitter, Prof. Benjamin, and I'll just try to get started. I want to keep this quick. So anyone that knows me knows that I do love local elections, and what we say amongst those of us that study local elections is that it's almost always election day. So on any given day, there's some sort of local election that might be taking place, maybe for mayor, city council, county commission, school board. But what we also know is that there's really low voter turnout in local elections. And so I don't want to shame any cities, but you can see your city here and you can see where people are and are not voting. But in these COVID times, I think what it's really highlighted is the importance of these elected officials, right? Local leaders know their communities, and guess what? Of any elected body, local elections are the ones where we can go to them, right? So you can just go to them, you sign up, you get your 3 minutes, and those elected officials know that we have direct access to them. And so why does this matter? Well, let me show you a quick little timeline from the New York Times. And as you can see, the sort of striped states are ones where local governments acted before their state level governments, right? And so you can kind of see the states moving. And this is where we are currently. And for those of you that just heard where I live, I'm in one of those states where our governor still hasn't shut things down. And so I'm thankful for these good local officials that have done that. We're not alone. Utah and Wyoming, the local government has been more restrictive than the state government. And then there are 5 states where no one's done anything. And so this is very concerning to me. And you might be thinking, why? Well, sorry, so we have that. This is as of the 7th. Right, and so what we can see, right, I think it matters, right? And it doesn't mean that every mayor was doing something better than their governors. New York is a good example where I think the governor wanted things to be done much quickly and much more strict, right? But in places like Alabama, when the mayors acted first, then the governor came out, then there was confusion. So how are residents making sense of these? You know, California acted quickly, but Mayor Breed acted a little bit quicker in San Francisco, and we know that they've had fewer cases. And again, here in Norman, shout out to my mayor for acting first, and then Oklahoma City and Tulsa followed after her. So I'm very thankful for her leadership during these times. But there's a lot of bad news coming out of these cities, right? So I know I won't take what other people have said, but you know, I care about cities. So when you look at a city like Chicago, African Americans are 32% of the city. They're 67% of these deaths, right? And so it's hitting us at a disproportionate rate. And some of these are states. Sorry, this is just the best graphics I could find. And so I have links when I send my slides out. You can get to them. But you know, there's just disparities, right? And so it's not equal, right? This disease isn't impacting, or this virus isn't impacting everyone the same. Black people are obviously being hit at a disproportionate rate. And so when I think about our local leaders, I'm thankful that they're trying to do their best to keep us safe. And so, right, but these disparities exist. And again, I won't say more than what my colleagues are going to say, but these are just some of the reasons, right? It's not that Black people are somehow doing things differently than other groups. It's that structural racism exists. And so this is how it's playing out. And so what can we do? Listen, other people have already said this. We need to complete our census, right? We need to be counted. We need to know where we are. But more than anything, I think the lesson I've learned from the last month or so is it's really important who we elect to represent us at these local levels. And even if you've never been a local voter, there's still time for most of us. Between now and November, there will at least be one, if not two, opportunities to participate in some sort of local election. And so I will just encourage you to do that. And I look forward to the conversation after everyone presents. Thank you.
Thank you. Before we get to Dr. Bonnette-Bailey, I encourage all panelists from this panel and the first panel, if you drop into the Q&A box your Twitter handle, but also the title of your book or publication that you would like for the attendees to read, that'll be a nice way for us to crowdsource that information and have a resource after the town hall where people can go for that info. Dr. Lakita Bonnette-Bailey, please.
Hello, good afternoon. Thank you all for having me. Today, I wanted to discuss the relationship between hip hop and the coronavirus. And so hip hop is continuing in their history, as their history has asserted. They are being the CNN for the Black community. In fact, it's groups and people such as Dougie Fresh, who has created a PSA specifically for how to deal with coronavirus, discussing things such as social distancing, washing your hands, and bringing on a number of other rap artists to be a part of the PSA with them. And so there have been a number of rap songs that have been created recently that deal with the coronavirus. Probably one of the most popular ones is Cardi B's, the remix of Cardi B's Instagram message where she says coronavirus, shit is getting real. That has been climbing the Billboard chart. So that is an example of one way in which people are discussing the coronavirus. And we'll come back to Cardi B in a second. So not only are artists actually creating songs, there are a number of songs from young people who are discussing the coronavirus. They're talking about this new way of life and social distancing, but they're also giving us information. So they are demonstrating within the music various tactics and tools that we can utilize. One, they are emphasizing to make sure that we maintain our social distance. So you'll see a lot of videos with people with masks on, gloves. They even made parodies out of some of the songs where they are spraying disinfectant spray all around them, making suggestions of other things to do. There's a young artist out of Britain who actually suggested in his song that we, to greet each other, we use our feet instead of interacting and using your hands. That way you can maintain that social distance. And this is particularly important at a time when we were discussing coronavirus and asserting through the media that it was not impacting younger people. Now we know that it is impacting younger people, and we have these young 18, early 20-year-old hip hop artists who are talking about maintaining social distance, who are discussing the ways to prevent you from getting coronavirus. And so this is really, really important because these are the groups, these are the individuals that young people listen to, and they are also emphasizing that we need to maintain social distance. So not only are rap artists discussing discussing coronavirus through their lyrics, but they're also donating and participating, donating their money, donating their time, and donating their energy. And so we can think about the idea of donating your time and your energy. We saw recently P. Diddy host a town hall where he invited a number of hip hop artists to participate, as well as politicians and healthcare professionals. And this was something that he did on his own because he believed that the way that the coronavirus, and so he wanted to make sure that we have our own discussion within the Black community about what was distancing, and that it was really, really something serious that needed to be taken serious by the African American community. And then there are a number of other people such as Jay-Z and Rihanna who have collectively donated over $2 million towards healthcare workers and those who are homeless, as well as those who are imprisoned and undocumented workers and the elderly population, to make sure that they have the necessary materials, but also that they have the resources necessary if people are losing their jobs. And so they have donated collectively. Jay-Z and McMill together have donated over 100,000 masks to the prison system, particularly the prisons, Rikers Island, Tennessee, Department of Corrections, and Parchment Prison in Mississippi, some of the first to acknowledge that they actually had coronavirus cases. And so they were giving them PPE there and donating masks to individuals there. Cardi B has donated meals to healthcare workers within the New York and Los Angeles areas. And so she's donated over 20,000 meals to New York healthcare workers. And Quavo has launched a fundraiser where he's worked in conjunction with Emory Hospital here in Atlanta. Quavo is a member of the group Amigos, is from Atlanta, and they are providing masks and other PPE equipment Atlanta area. And there are a number of people that are providing washing stations, for example, to homeless. So there are a number of ways in which hip hop, and we can talk more in detail about the ways in which hip hop has been involved, and hip hop has actually been helping to inform people about the coronavirus and the safe measures, but also donating their money and their time and their voice. And so we don't want to make sure that we continue to talk about voice. Cardi B and others are continuing to use their social media to talk about some of the policies that are coming up. She just recently did an Instagram post where she was discussing this idea of reopening the country and how she feels. And she did this in conjunction with Bernie Sanders, that that Trump and his administration are actually putting the economy ahead of the health of individuals. And so we are seeing a lot of ways in which they are discussing, hip hop artists are using their followings and their fans to talk about issues that are relevant to the Black community.
Thank you, Professor. Next up is Professor Jonathan Collins from Brown University, please.
Right. Share screen here. Let's see. All right. I'm muted. All right. I'm going to talk about COVID-19 and.
I think you got to put your video on, Jonathan.
My video is not on. Should be on.
There you not yet, but
Yeah, I could see him.
Okay, that's good. Okay, sounds good.
Let me try now. What about now?
There you go, got it.
Good. Okay. My name is Jonathan Collins. I'm assistant professor at Brown. I'm going to be talking about COVID-19 and Black K-12 education. So what I'm showing now is just the National Center for Education Statistics produced data on essentially how states are responding to COVID-19 with school closures. As you'll see, the majority of the states have taken what I consider a relatively aggressive stance of automatically mandating that schools close for the academic year, while you've seen variation across states though, and you've seen states that only recommend and leave the discretion up to the districts. You've also seen states have terminal dates that are shorter in time than the academic school year might allow. So what I do is I take the data from the Department of Education and I incorporate the percentage of the Black population in each state and try to see if there's a correlation there. And I do find that the more aggressive school closures seem to be happening in the states that have the highest Black populations, which could potentially be a good thing. It seems that that the state leaders are coming in and immediately shutting down schools in states that have significant Black populations. While the schools are closed, though, schools are providing food. The Families First Coronavirus Response Act created the Pandemic Electronic Benefit Transfer, the PEBT program, which they've been using to essentially assist schools in providing meals not only to students, but families during the crisis. Online remote instruction is also happening. There's evidence suggesting that online instruction actually can be as effective as face-to-face, but the problem is these studies mainly look at credit recovery programs. So we're still unsure how this will affect Black students, especially thinking about students who are trying to engage in online instruction at the same time as other students who already have embedded advantages. The recovery studies suggest that especially variation in instructional quality is a key determinant, but Black students are more likely to be in schools where teachers are overburdened, larger class sizes, less staff support. Black students are also about 15 percentage points less likely than white students to have computer access at home, which could be detrimental to online learning. Black students are typically more reliant on smartphones. Homeschooling is also happening. There is the effectiveness of homeschooling is actually very much driven by essentially parents' disposable time, how much free time or flexible time that parents have, which is heavily dictated by income. This is in homeschooling instruction in itself becomes less effective as kids move up in grade level. So these are this is kind of the constellation of obstacles that students are facing, especially Black students, who are thinking about the move to online instruction and what it means when schools are closed. There are recommendations coming from the education research literature, extending the school day and or the school year, but this requires additional pay for teachers, administrators, and staff, things that become crippling for a lot of urban districts. Providing extra tutoring, particularly bringing in recent college graduates, but this requires funding to hire enough students to keep the sort of student to tutor ratio relatively low. Elementary looping is another suggestion, where teachers essentially follow the students to the grade level, but this places an additional burden on teachers to adjust to the expectations. And as I already mentioned, teachers are already overburdened in schools that are usually segregated and have high levels of Black students, high percentages of Black students. Access to school health professionals is going to be key. But again, this requires funding to cover the salaries of the employees who would need to be brought in to provide these additional services. So just a few things to be aware of moving forward. Be on the lookout for cuts in Black school personnel due to city, county, and state budget cuts. Inability for schools and districts to hire school health professionals. Delays in granting certification to new teachers and processing new teacher hires. Permanent school closures, especially in our communities. Growing Black-white achievement gaps post-quarantine as a result of the issues with online instruction and homeschooling. Gaps in college access and career opportunities, and also difficulty in holding school boards and state education boards accountable. So that's it for me.
I appreciate that last PSA. Thank you, Dr. Collins. Next up is Professor Jamila Michener, please.
right, I am coming, just sharing my screen here. If I can. What's that? Nope, wait.
Do you see something that says start video?
Yeah, I'm gonna do that right now, sorry.
Yeah.
Okay. Okay. All right. Sorry. There we go. All right. Thanks for hosting this to Kalila, Dr. Brown-Dean, and Dr. Franklin. This has been really helpful for me, just sitting here and listening to the different folks with expertise and learning a lot along the way. So I'm going to try to move relatively quickly so that we have enough time for Q&A. And I want to focus on thinking about poverty and COVID-19, and particularly in relationship to the Black community. So I'll just start with the observation that won't surprise any of us, which is that Black poverty was already disproportionately high before COVID-19 struck. Oops. So if we look at the 2018 data, we can see that African Americans were more likely to be living in poverty than any other racial group in the US. And so, of course, I think it surprises no one that COVID-19 is going to exacerbate these already existing racial poverty gaps. And so some interesting simulations from a few scholars at Columbia University that were just published recently in the New York Times looks at different unemployment scenarios and what they mean for the poverty rate in different communities in terms of race. And so we know just the baseline is that Black people are more likely to be living in poverty. But when we look at the different potential scenarios for where the unemployment rate can go, that the higher unemployment goes, the more sort of wide some of these gaps in terms of racial poverty gaps are going to grow. And you know, this is keeping in mind that when all is quote unquote well, African Americans are often have rates of unemployment that are twice as high as whites. And so the baseline is a huge gap in terms of unemployment and poverty. And we're just based on the data that we have and the simulations that we've already been able to assess, we know that those gaps are going to be widening substantially in the coming weeks and months. So of course, policy interventions are going to affect these disparities, and they are going to play a role in just how wide those racial poverty gaps get. And so when we think about policy interventions, of course, the biggest one to date is the CARES Act, and that's what a lot of folks have already been dissecting in terms of the ways that this policy might have differential implications across different racial communities. One thing that I want to point out is that state policies are going to be imperative as well. They're going to be particularly imperative. We're already seeing differences emerge in different states that map onto their sort of pre-existing ways of structuring policy, and in particularly policy related to poverty and economic inequality. And so in a state like Florida, there was a lot of news coverage last week and this week about how little Florida was paying out in terms of its unemployment benefits. And that was happening before COVID-19 and came to light as even more of a problem afterwards, right? When we think about, for example, the state variation that already exists with respect to anti-poverty policy, like TANF, Temporary Assistance for Needy Families, which is a cash assistance, we know that there were already pretty substantial differences in terms of how states implemented various aspects of this policy, right? Work requirements, time limits, precisely how much money states were giving people in actual cash assistance versus other forms, other mechanisms for spending these funds, often spending them in ways that did not actually result in helping people who were living in poverty. And so while the big kind of headliner federal policies have gotten our attention, as they well should, it's going to be really important to keep an eye on what states are doing, and specifically with respect to these social policies that Black people disproportionately rely on. So policies like TANF, like Medicaid, like Women, Infant, and Children WIC nutritional assistance, like SNAP, Supplemental Nutritional Assistance Program, and so on and so forth. So there are already a whole range of policies that states have quite a bit of discretion over, sometimes in setting the eligibility requirements, always in administering. And these programs are going to be even more crucial to people in the wake of COVID-19, and they're going to be most crucial to Black people, because before this, Black people were relying on them. They're going to be hardest hit with respect to unemployment. And so after, they will continue to be relying on these programs and during. And so states have a lot of power over what happens. And even the fact that states are still blocking Medicaid expansion, that a number of them, even when we're in the midst of a pandemic, are refusing to expand healthcare benefits, is a signal of just how important it will be to keep an eye on what states are doing and to hold them accountable. And of course, implementation of the policies that we're seeing in the headlines will also be crucial. So for an example, we heard about eviction moratoriums in cities and states all across the country. But now we're learning that renters are still being evicted from their homes despite those moratoriums, right? So policies are being passed, and the notion is that these policies are going to provide folks with some sort of relief. And it turns out that that relief is not coming in the ways that have been promised. And for almost every single one of these policies, they have disproportionate implications for Black Americans, right? So evictions, we know, are a problem that in a sort of starkly disproportionate way affects the Black community. In particular, Black women are more likely than any other subgroup to be evicted. So the moratorium on evictions in many ways was a form of relief that was particularly targeted, perhaps not intentionally, but in practice, to Black women. And so when that doesn't happen and these evictions are still occurring, it also means that the negative effects are going to unfold in that group as well. Texas is another example. And a Google search can give us so many headlines about the number of places where local, state, and even federal policies are not actually being enforced. And many of these places are places that have the highest numbers of African Americans as part of their population. And so particularly in states where Black people are suffering more than others, I think the issue of implementation of policies is going to be especially crucial. And then, politics matter. And this has been, I think, a theme that has come up over and over again. And one thing I'd point out is that electoral politics certainly matters, but so does non-electoral politics. We've seen, for example, calls for rent strikes across the country, and tenant organizing groups have been, on high alert, and they've been working virtually and through all the channels that they have open to them to organize tenants. We've also seen talk of labor strikes and work strikes. And so there's organizing happening in communities, even virtually, and there's an effort to hold political elites and economic elites accountable to the kind of things that are happening in this present moment, and things that are happening disproportionately to people living in poverty, and disproportionately to people of color, and especially to Black people. And so policy is about intervening to provide relief to these groups, but politics is what's going to shape the nature of that intervention and what's going to hold people accountable to actually fairly implementing the policies that are passed, and what's going to hold people accountable for the policies that do not end up being passed and the damage that ends up happening in these communities as a result. The good thing about this non-electoral piece is that it means that in addition to going to the polls, which we'll all have opportunities to do in the coming months, we can look around even now and think about what organizations in our communities are doing work to organize workers, to organize tenants, to organize folks who want to fight for policies to help those who are most vulnerable. And we can all do that. We can all find and support and find ways to participate in these kinds of organizations. And it's a way of enacting a politics that can actually address some of the issues around race and poverty that continue to haunt us in this country. Thank you, everyone.
Thank you, Dr. Michener. Our last panelist is Dr. Ray Block Jr. from Penn State, please. Dr. Block, are you on?
Can y'all see my screen?
We can.
Okay. I want to again thank NCOBPS and Professor Brown Dean and Professor Franklin for putting on this series of panels, and for letting me be involved. This is a wonderful service y'all are providing, and I'm honored to be a part of it.
Make sure you turn on your video too.
I didn't, okay. It says that I can't. It says the host has stopped it.
I would have to troubleshoot it, I think. Just give me a second if you can.
Yeah, sure. So nothing's showing up? You can't see my slides at all?
You can see your slides, but not your video. That's the caveat to this, which is why it's and let me just troubleshoot it if you can.
Sure.
All the panels. Okay. Okay.
Okay, so I think it's letting me now.
Okay.
How about now? All right, so thank you much. I'm going to start, and I'm going to move pretty quickly so we can catch up for lost time. So 2 caveats before I even get started. This will be more descriptive in nature, and my goal here for this presentation is to talk about what the landscape looks like when it comes to attitudes about exploring race and public opinion. But my approach to doing so will be that I'll be looking at racial differences in attitudes about the pandemic. So on that note, there are many efforts out there to learn about what the public thinks about COVID-19, and especially about its impacts on communities of color. This is an interest of mine, and I'm actually part of several polling projects that will explore just that. In the meantime, however, I am relying on preliminary evidence from recent surveys that are publicly available to give you a quick look at what the landscape looks like when it comes to COVID attitudes. And in this case, the information allows me to explore those racial differences in a host of areas, as you can see. So about the surveys, the main survey comes from Pew, and it's a large survey in terms of sample size, and it has a very comprehensive set of items in it. And that means that most of the information I'm going to be showing with you comes from that. When I can, I'll be showing you supplemental information from a CNN poll that was collected in March, and also an ABC News Ipsos poll that was collected in April. And the point of it is, whenever there are items in the supplemental polls that resemble the items in the main poll, I can plot trends over time. So from time to time, you'll see that in the presentation too. First thing we should get to is the perceived relevance of the coronavirus. So if you look on the left side of the slide, you see that high numbers of people are following the news when it comes to the pandemic, and that shouldn't be surprising to anyone. What I think is interesting is the stuff happening on the right side of the graph. And what you see there is a trend here. And there's a trend looking at the percentage of people who say that the coronavirus outbreak has altered their lives in some meaningful way. And there's always an increase. And so there's a small increase for the white respondents between mid to late March and early April. There's a large jump for African Americans when it comes to the percentage of people saying that the coronavirus has somehow upended what their lives are like. And I think it's important for us to check out these trend changes, because this is going to be a pretty consistent theme throughout the information I'm going to be giving you, where everyone's being affected, but it seems like perceptions of the effects differ significantly for communities of color. Looking at the perceived responsiveness of the outbreak, there's a lot of information here, but I just have a series of clustered bar graphs that show you how various entities have dealt with the outbreak of the coronavirus, and the entities are government officials and various institutions, the media, and ordinary people. In the interest of time, I want you to look over here where my arrow is. And this part of the bar graphs show the percentage of people who believe that President Trump is doing a poor job handling or responding to the outbreak. This finding already makes sense to me, but I wanted to make sure that I gave you a moment to appreciate the fact that African American respondents are highly represented in the response category, saying that the current president is doing a poor job. And the next slide that I'm showing you takes that result and trends it out over time. So because I was lucky enough to get Pew data, CNN data, and ABC News data across 3 periods of time, you're looking at what is a clear piece of evidence of racial polarization and people's attitudes about Trump's response to the outbreak, where if you look overall, generally respondents are saying that Trump didn't do a particularly good job. Nearly half the white respondents are saying that Trump did a poor job, and that trend's pretty steady. What isn't steady is the increase going up for African Americans, where African Americans are increasingly well represented in a response category, saying that they just don't think that the president's done well when it comes to responding to this. None of this is surprising, but it helps to paint the story that I'm giving you about the landscape of opinions that people have about the outbreak. So let's look at reaction in other venues. And so we can look at how respondents believe others are responding to what's going on, whether specifically they believe that people are overreacting or underreacting or acting appropriately. And it is interesting here that there's not much variation across groups when it comes to impressions about state and local government and school systems. In other words, generally people believe that those entities have behaved appropriately when it comes to responding to the outbreak. You see more variation across people when you compare Blacks and whites with respect to their opinions about people across the country and people in their communities. Specifically, compared to Black respondents, white respondents believe these groups of people are overreacting. And conversely, noticeably more Black people compared to white respondents believe that people in their communities aren't taking the pandemic seriously enough. Just something to note. When you get back to this end of the chart, you notice that when people are thinking about members of their households, generally folks believe that folks in those particular parts of their circles are behaving appropriately. Now, I like these items because they get at this idea that we have a new reality and it's difficult for everyone to adjust to what this new reality is. I'm going to focus on the middle of the plot here. So the results for church attendance are fascinating because it appears from the survey responses that higher percentages of African Americans compared to their white colleagues are opting to attend services virtually. And it makes sense given its disproportionate impact on communities of color, that larger percentages of Black people are reporting that they are praying to get through the pandemic. Finally, knowing what I know about racial differences and who tend to have what are recently been deemed essential versus non-essential jobs, it makes sense that more white respondents are reporting that they're working from home compared to African-American respondents. Put simply, many Black respondents don't have the luxury of working from home, which was something we discussed in a previous panel. So since we're talking about working from home, we're getting into a nice segue into talking about economic anxieties. And I'm going to focus on the left-hand side of this graph here. And not surprisingly, more Black people compared to white respondents either have experienced or know someone who has experienced a job loss and or pay cut. Want to skip ahead here? And we're looking at policy attitudes, and there were plenty of them in the Pew survey. And so I listed them all here and gave you a series of clustered bar graphs so that you can make sense of the patterns here. If you squint your eyes and look at this, what stands out to me is how consistently similar Black and white respondents are in their policy opinions. And in this case, it's looking at whether or not people support or not support various things that have been implemented by state and local governments and supported by federal government when it comes to flattening the curve. And so you see more opinion similarity than you see difference here. To satisfy curiosity, I took the same policy attitudes and looked at them across party as opposed to looking across race. And the results still stay pretty similar, but there are two findings that I think are worth focusing on here. The first one is that more Democrats compared to Republicans support the closing of non-essential businesses. And likewise, there are more Democrats than there are Republicans who support delaying upcoming primary elections. Those two findings dovetail nicely onto current media and political narratives, and they make a lot of sense given what we know. So because I'm trying to move quickly, I'll stop here, and I'm ready to deal with questions and to take comments at this point. Thank you.
Thank you, Dr. Block. And thank you to all of our panelists. I would ask that our audience continue to put questions or comments into the Q&A box. We've been monitoring that and collecting that. So in the time that we have left, what I'd like to do is throw out two big overarching questions that I see have come through consistently through a lot of the audience comments. And the first one would actually be to Professors Middlemass, Michener, and Collins. And in connecting to our first panel, we heard a lot about the importance of the census. And so I wonder if the three of you could talk about, in connection to your issue areas, how important this census will be for who gets counted, where people get counted, and then the resources that get allocated based on that. So if we know, for example, most inmates are housed in more rural areas but come from cities, what will that mean from getting the census resources that they need in order to successfully re-enter? If we need money for public education, or we need money to keep people from poverty, how important is the census beyond just showing up and being counted, but also what it means long-term? So if the three of you could address that, please.
All right, I'm happy to start. I think that's a great point of connection. Thank you for drawing that out for us, Dr. Brown-Dean. I think, you know, you've put the nail on the head with respect to how crucial the census is, and with respect to the range of issues at stake. So the census is about sort of properly counting folks. It's about political apportionment, but a huge part of the census is really about knowing sort of where help with respect to social policy needs to be directed, which communities it needs to be directed to. Even having accurate counts around things like rates of poverty, right? There's constant debate about how to measure poverty, what the actual poverty rate is, and what racial poverty gaps, what the extent of racial poverty gaps are. Those are the discussions that affect decisions about policymaking, and even more so than decisions on the federal level, that kind of data affect decisions on the state and local and a kind of hyper-local community level. And so unless these populations are counted, we're gonna have inaccurate data, and we're not gonna know what kinds of policy interventions are best suited for intervening in these communities to help. So I think that it matters, and it matters the most, frankly, for Black people.
Thank you.
I'd like to pick up on what Dr. Michener just said, and Dr. Brown-Dean has done research on prison gerrymandering. It is critical in where people are housed, where they live is where they're counted. And unfortunately, with the over-incarceration of Black people, they are counted in these rural communities, and the rural communities are then provided money at the federal and the state level based on the census numbers. So for any of those individuals that are listening, if you know your loved one is coming home and they will be home in the next month, I'm sure I'm probably gonna come into some legal issues here, but just forget the legal issues for a minute. Count your loved one like they are at home right now. Like if you know they're coming home in the next 2 or 3 weeks, because we know all these people are literally going to be released, count them as if they're living in your home when you go and fill out your census forms. Because our communities are underserved based on where they're counted. They're counted based on where they're incarcerated. And if anybody's really interested in looking at this, there are some geographers and individuals that do GIS and sociologists that literally have created what are known as $1 million blocks. So what they do is they look at a block, literally a city block, count the number of people who are incarcerated in that block, and then think about the dollars that follow those people to the incarcerated, to the criminal justice system, but the money does not follow them back home for the next 10 years because they're counted where they're incarcerated. These $1 million blocks are in our communities. They're in every major city in the United States. And the only way to get around that is to count your loved one as if they live at home. I'm not saying doing it for everybody that has an incarcerated loved one, but I'm talking about if they're coming home in the next 2 or 3 weeks, count them like they live at home.
And if I could add a little bit about education. Thank you, Dr. Brown-Dean and Dr. Franklin for putting this together and hosting this. Actually, to your work about gerrymandering, it's really important for education as well. State power pretty much determines how we're able to administer education and what that looks like. And a big concern that I have is, are academic standards going to adjust to the new normal that we're presented with COVID-19? You know, states are developing standardized testing mechanisms. They're offering recommendations on how to facilitate online learning. Are we doing this in a way that is consistent and fair with what Black families are essentially able to do from a capacity standpoint, given how we're hit by COVID-19 in a lot of the ways that Professor Middlemass and Professor Missioner have just mentioned? So those are the big things I'm concerned about.
Thank you. And so for our other 3 panelists, seeing a lot in the comments and the questions is really about going sense of power and who has power to make these choices and decisions to speak on behalf of these communities, whether that is the power to share the media narrative so that people know who's most affected by this and what this means to be vulnerable, whether it is the power for hip hop artists and other social media influencers to use their platforms to get that info out, or if it is the power to say that if people are receiving conflicting messages from their faith-based institutions, how do you push back to say, we will be most effective, so now we would do that? So if the 3 of you could speak to how those issues of power, of agency, really apply to your areas of interest and expertise, please. You have to unmute yourself. So Andrea, I see a smile, Professor Benjamin. So if you could talk about that. I saw the comment about really about federalism and who has the authority. If the president is saying he has the authority, but the city of Chicago, Mayor Lightfoot is saying, no, I have the authority. How does power play out in what you know about cities and municipalities?
Yeah, so the reality, and I think I typed this question, so hopefully it's in the comments, but you know, the reality is that because of Dillon's rule, which is basically saying that cities get their charter from the state and therefore state power supersedes city power, 40 states, most states use that rule. So luckily what we haven't seen, although Alabama and I think maybe Florida, it was a little bit of more of a back and forth, but like in Oklahoma, the governor does have the power to do what he wants, but luckily he hasn't stopped our local officials from sort of offering a more strict shelter in place. And so really it is, right, it is about power, right? And so the state government in most places has the power to stop local governments from doing lots of things. And we see that often over the last couple of years, right? It's called preemption, and many states use it. And so, I'm thankful, but again, to my point, which, I was trying to keep my comments brief earlier, but this is why local elections matter, right? I cannot overstate enough. And I'm saying that as someone who lived, like, I'm literally looking at my family at home and they're like, you should have come home, because it's probably safer for me there, right, than it is here. And so it's very scary if our governor, right? So yesterday I said on Facebook, if the governor never shut down the state, can he open it back up, right? So we're not really shut down. It's just a matter of us sort of deciding that we're not going to be doing all of these things. So yeah, power definitely matters. And hopefully, here, hopefully we are listening to our mayors, because they're the ones that are offering the clearest and, to me, most comprehensive guidance about what we should and shouldn't be doing.
Thank you. Doctors Block or Bonnette-Bailey, please.
I definitely think when we're looking at hip hop has demonstrated how it is using its collective power to fight back and to respond. But not only power, is freedom and its resources, and its freedom through the resources that it has, and the ability to actually discuss these issues, to hold town halls to discuss these issues, to rap about these issues, to create PSAs about these issues, but also to advocate on behalf of those who are voiceless, right? And so to Cardi B, for example, discussing the issue of being a celebrity and having the economic mobility that she has, and how she has access to testing early on, when individuals who do not have the economic means did not have the access to testing. So she utilized her voice for those that were voiceless, those who could not come out and say, hey, look at us, look at the impoverished group. We don't have access to this testing. And we're seeing now the results of that is affecting impoverished people disproportionately. And we have hip hop as coming out and saying and speaking on behalf. And we can look at all of the efforts by numerous people who are speaking on behalf of various groups who are often voiceless. So those that are incarcerated, Rihanna with assisting those who are victims of domestic violence, those who do not have the help and the support and are not getting as much help and support from the government. We are seeing hip hop utilize its power and its freedom and its economic resources in order to help other individuals.
Thank you. Dr. Block, what do we know about trust and public opinion and our ability to resist some of these media narratives and other influences that affect how people navigate this crisis?
Well, we need more work like this. I was over there typing like crazy before we spoke, because there were a couple of questions about it. And the answer to all of the questions I've gotten so far is that more stuff is on the way. And so on a short notice, I'm putting together research that's based on polls that I didn't do, right? And one of the things that me and several collaborators are trying to do in a hurry is create surveys that allow us to more effectively learn what communities of color care about and why they care about those things and what we can do, right? As a polling researcher, one thing that I think is really important is that those polls allow us the opportunity to test the effectiveness of certain messages. And so from a message testing standpoint, there are opportunities for us not only to learn the opinions of people in our communities, but also to see what messages resonate best with members in our communities. And that can be used towards mobilization purposes. It can also be used to the benefit of allowing us to have more control over the narratives that are used about our communities when it comes to COVID-19. So all this to me is an opportunity to get real busy right now.
Mm-hmm. And I will say, to bring in some of the comments that we're seeing in the Q&A box as well. For some people, there's a level of surprise that communities and organizations weren't already structured to address some of these concerns. So we've had decades of natural disasters and storms to let us know that when these crises happen, the communities that tend to suffer most are Black communities across the diaspora. And so for some people, there was the surprise. And I want to raise for everyone here a comment and a question that comes from a couple of panelists, attendees, is your thoughts on what the Black public sphere looks like in this moment, but also when we get to a point of recovery. Dr. Block talked about, faith-based institutions and the increase in online attendance. There are fraternal organizations and civic groups across cities and rural counties that often became this space where people could exercise these tools, develop these skills, and be able to navigate. What should that space be doing? What should it look like now in addressing some of the issues and areas of concern that you all have raised? And feel free to jump in and unmute yourself at your will. Now, you can't treat me like the students in my class and not talk back when I ask a question.
I will break the ice here, and I trust that that others who have more brilliant things to say than I do will follow. I think this is really important. I think there's a moment here clearly of crisis, but most moments of crisis are also moments of opportunity. But the opportunities that emerge are contingent on what it is that folks do now. And so what the Black public sphere is going to look like going forward, I think depends on what happens now. I think it depends on the level of organizing that happens in Black communities and on some of the innovation that is going to be necessary to reimagine and re-envision and reconfigure organizing in light of the limitations that we're facing with social distancing. And so thinking about social media and how it's used, how it's deployed. But I do think that there's going to be opportunity just because there's going to be an increased kind of appetite for learning about these things. I wrote a piece a few weeks ago on social policy, in the wake of COVID-19, particularly with respect to vulnerable workers, like workers in the gig economy. And my brother was talking to me about it and really engaged and wanting to know what the policies were and what was happening in response to this. And those aren't the conversations that we normally have, right? So I think folks who weren't thinking like, well, who is eligible for unemployment? And, what should the relationship between landlords and tenants be? And what kinds of support should I or can I expect from the government? That might have been those are things that were not on people's radar in the same way before that they're going to be now. And so as people are primed to think about these things and to wrestle with and think sort of critically about, what the role of the government is and what the role of various, their employers and various other entities look like, there's an opportunity to kind of swoop in at that point and say, let me give you some frames for thinking about this. Let me give you some channels for acting. And the question is whether the infrastructure exists as far as organizations and other key actors to take advantage of, in a positive way, those opportunities.
Thank you. Anyone else?
As for hip hop, all right, go ahead.
So I'll be quick. So I'm thinking again, so Professor Brown-Dean started with a conversation about trust, right? And I'm thinking about the receptivity of people in communities of color to trusted information sources. And Professor Crawford actually asked about this during Q&A, and I wanted to make sure that I addressed it a little more, right? One of the things that I'm hoping that we can do with the subsequent polling that we're going to be a part of is to see about that, to see which parts of the public sphere that is indigenous to our communities are the trusted information sources, because that will be really useful for us in terms of thinking about how messages get out and how messages get implemented. If you take faith-based institutions, we already know how influential they can be. And I'm also thinking about non-faith-based institutions. This is an anecdote, but one of the members of my family goes out of their way to listen to the news from Black sources because they just don't trust what they're hearing, and the abundance of the things that they get that are either contradictory or just factually incorrect has literally forced them within when it comes to thinking about where their spheres of information are. And I think that the message testing I'm proposing and thinking about really needs to be attentive to where those messages come from.
Thank you. Dr. Bonnette-Bailey, did I hear you
Yes, and Dr. Block actually gave me a great segue into what I was saying about those trusted sources and utilizing alternative sources and Black media sources, of which hip hop is a part of this Black counterpublic in a way to spread information and informing others. And so what we've seen historically is that hip hop has always played a role in providing information. Not only through their music, but also by hosting various summits and town halls, and they're continuing to do that. And I think that is only going to get stronger after this pandemic ends, that more people are going to turn to hip hop artists, turn to hip hop stations like Revolt TV, and some of those other types of stations where you can get alternative news or news from this hip hop enclave that exists, as well as listening to the messages that are presented by some of these influential hip hop artists through their various social media accounts and following them, listening to their podcasts and other sites that they have. And so I think it's going to continue in that way, that people are going to rely on hip hop, and hip hop is going to continue to provide a role model in such as far as political ideas and attitudes, and shaping those political ideas and attitudes of individuals that are tuning into hip hop to receive their information.
Thank you. One of the other things that's come up in quite a few of the comments from our viewers is that to some extent there is a generational question here as well. There are children and young people whose lives will be permanently shaped by this crisis, and our response to that, how they will carry that trauma with them, and how we have the resources in our schools and other places to effectively deal with that, so that how children respond to that trauma does in education institutions, for example, does not then make them predisposed to the kinds of criminal justice institutions that Professor Middlemass thinks about. But for our older populations, there's also this sort of racial fatigue of people feeling like they have had to navigate with people not being concerned about their lives. So their willingness to engage in those non-electoral political protests, for example, or keeping people accountable may make them less likely. What's the message that as people, wrap this town hall, and as people are going back into their communities, back into their professional careers, back into their academic spaces, what is the message that we should be giving as we seek to bridge those generational divides and make sure that recovery, whatever that looks like, is inclusive of those different sectors of Black communities?
I guess I'll jump in, and then then the smarter folks can come in behind me and give the better remarks. But I mean, I think the immediate thing that comes to mind is there's a glass half full. I don't know, half is maybe not even the best way to think about it. It's probably only a third, a fourth full. And that's the idea that we'll have some opportunity to remake our institutions in a different kind of way. We'll be able to kind of remake our political landscape in a different kind of way, thinking about our schools and our schooling institutions. Now we'll have opportunities to remake our schools, think about curriculum that really suits our needs. Now there is a pressing urgency around online instruction materials that are geared towards students who don't have the proper access to, whether it's internet or especially the classroom. Now that is on people's radar, that becomes something that hopefully can create some opportunities to level playing fields down the road. But that's the only kind of positive that I can kind of glean from this, that I think folks can take home with them, is that, with this tragedy, I think we'll come for some opportunities to where, if we're well organized and politically engaged, that we could actually make institutions look much better.
Thank you. Anyone else? I see a couple more questions, and we have a few more minutes there. One question, in some ways, is related. One is, are we seeing differences in leadership style and crisis management? I saw a wonderful video from the mayor of, I believe it's West Memphis, Tennessee, who said very poignantly, no disrespect, but stay home. And not have made clearer than that. So are you seeing differences in that leadership style or the reception to leadership style. And I think that goes into things we've talked about across the board about trust and accountability, but also credibility for people to respond to what they're being told and saying.
I'll jump in, sure, right? I think anyone who's sort of been on social media in the last couple of weeks, I think the sort of funniest memes that have come out are Mayor Lightfoot in Chicago, right? And she herself has taken the joke really well and sort of retweeted herself, like some house had like a cutout of her talking about stay home, and she retweeted it. But I do think it's a testament to this notion of credibility, and who do we look to for those messages, as Dr. Block was talking about, who do we trust? You know, and it might be that, you know, as Dr. Bonnette-Bailey said, it might be that we trust our hip hop artists, right? We know that they've been at the front lines, and hip hop activism has been a part of that culture for a long time. And so it might be that in a normal situation, you know, that's who I would look to anyways, right? As that's who I view as a community leader, or that's who I view as someone who I trust. So I do think it is an opportunity, but to Dr. Collins' point earlier, I do think it's an opportunity. And I know someone asked in the comments, sort of to me directly, sort of what are local organizations doing? You know, I can't speak to everywhere, but I know here in Oklahoma City, you know, I got a shout out on one of the boards, but I'm actually on another board here in the city, and we have been actively working behind the scenes, and it's set in the east side of Oklahoma City, which is the Black part of town here. And we are working because once things open up, yeah, who do you trust? Who are you going to believe to go get your testing? We already have a bad history in our community. I'm not just going to go right? So we're already thinking about that. And I know we're just one organization, but, you know, we've received emails from other organizations, and I know we're trying to connect and get a list of resources, and, you know, people are putting out lists of things that we need. So how can we, you know, those of us with resources, how can we contribute to that? So members of our community are getting the things that we need. So in that sense, in many ways, I know churches are doing that here locally. I'm assuming they're doing that in most places, but in many ways, the Black counterpublic then is already situated and in place to minister and administer what our community needs for us, right? And so even when the messages coming out from the state, from the federal government, maybe aren't in line with us, right? I think it was on the earlier panel, like, you know, the Surgeon General tried to play us, y'all. So he, you know, I mean, you know, that like, that's not who we're going to trust then, because you let me know with the way you spoke to me in my community that you don't think that we're smart enough to do this, that you think we're dumb, right? So I'm not looking to you as a messenger anymore, right? So who can I hit locally? Maybe my church, maybe some sort of, you know, the Black Chamber of Commerce here has been really active. They've been helpful making sure that here the Black-owned businesses can get the loans, the programming, those programs that were available. So I think in that sense, we're already equipped to sort of bring our community back up. And to the extent that we have a relationship with those members of the community, then yeah, we will be the trusted source, or those churches, those organizations. And so we're just, you know, like I said, again, speaking just for what I know, you know, we're already moving to position ourselves so that we can be that trusted source when the tests become available, when things kind of open up. And so I think that's what most communities are probably doing, something like that.
So in the time that we have left, to follow up Professor Benjamin's point, as we all look forward to the grand reopening of outside, I'm going to ask each of our panelists to quickly think about, because this was one of the questions, as we think about helping, as we think about supporting, what's the advice that you would give to organizations or agencies who want to do something and want to do good work to impact that? So I'll start with you, Professor Middlemass. What is the advice that you would give to organizations, leaders, and individuals?
From an individual perspective, I think we just need to look in our own communities as to what organizations that already exist. So for instance, for reentry in DC, there's an organization called Free Mind, and it's about writing, and it sets up structure for individuals that are returning home to DC. And they meet once a month, and we write comments and we write letters to those that are incarcerated so they know that they've got a community when they're returning home. For those that are thinking about policy, particularly as scholars, we know people and we do the work ourselves, is the CARES Act has a huge amount of money, just millions of dollars going into local communities right now. And if you can offer your services as an intellectual, as an analyst on policies, that is a service. And I don't talk about giving our work away for free, but doing this idea of all these nonprofit organizations are going to get a lot of money, and they're going to want somebody to evaluate and figure out the best way to spend that money. And we can offer our services, particularly those that look at policy impacts of existing policies. We can then connect with policy people that are already doing the work. We don't have to, basically what I want to say is we do not have to rebuild structures. The institutions already exist. Go to your church, connect with organizations that your friends may be on the board or already volunteer for, and that way you can get involved. You don't need any special training to individuals that are listening. Just have to have an interest.
Thank you. A willingness. Thank you. Professor Benjamin, please.
You know, I really think Dr. Middlemass said everything I would say, so I will just second that and just know that we have the structures, we have the resources, we have the mental and physical capacity that we need when outside opens back up, just get to work.
Thank you. Dr. Bonnette-Bailey.
As far as advice to leaders and individuals, I would say that we need to look at some of these individuals that are leading the forefront now. One thing we didn't really mention on this panel was the role of gender as far as making policy and closing down cities when the state government did not, right? And so a lot of women we know are associated with or are supportive of issues of healthcare and education. And these are the cities that were run by women mayors, or the cities that were closing down first. These are the cities that had the hard and fast rules of closing down to stop the spread of the coronavirus. So thinking about our leaders, again, seconding what Dr. Middlemass said about the policy and serving as policy experts to tell them which ways we should direct our dollars. But they are also thinking about ways in which they should best benefit their city. But to go back to hip hop, remember that hip hop was also, it represents intellectual as far as informative, as well as mental capacities. And so we've seen ways in which hip hop has continued to not only give us information, but to provide entertainment and to give us a break from some of the mental anxiety that we're feeling in the world. And so we're seeing various artists also utilize their social media streams to host virtual parties, to have virtual dance contests on social media and various other ways, but it's a way for us to escape some of the things that are going on. And we need that mental escape. We need that ability to also deal with the anxiety that this pandemic is inducing and to have a way to go. So hip hop is able to deal with the number of aspects of our well-being. So I think we need to continue to support our leaders and listen to what our youth and our leaders are presenting at this time.
Thank you for reminding us that joy is an act of resistance that we don't have to apologize for. Dr. Collins, please.
I think it's just an important moment to support our Black parents, especially our Black mothers, who are having very difficult times right now, taking on a responsibility of being the sole provider of education and everything else for their kids. So everything that we can do to support parents who are struggling with the change, unsure about what tomorrow is going to look like. I think that's the most important thing. And then our young adults who are about to transition from a crazy schooling environment into a very uncertain economy. How can we be supportive of those folks who are in really, really, really vulnerable positions right now?
Thank you. Dr. Michener.
Yeah, I would, on the individual level, I would definitely follow on what Professor Middlemass and Professor Benjamin have already so brilliantly laid out, which is that the infrastructure, the opportunities are there, and it really is a matter of not reinventing the wheel, but recognizing what exists and being willing to get to work when the time comes. I would also say on even more of a micro level, for folks who have resources, for folks who have means when it comes to poverty, there's a ton that we can do in our communities. There are food pantries, there are shelters, there are places that provide direct services and resources that are struggling right now. And we can target any donations we might want to make. And we can decide to make donations in communities where we know Black folks live, right? So our physical resources matter as well. And then I think lastly, perhaps to anyone who might be listening to the town hall, who actually has a leadership role in some sort of a nonprofit organization, whether that organization is providing direct services, whether that organization is doing advocacy and strategizing about next steps politically. I would encourage folks to sort of recognize the heterogeneity in the Black community and recognize that there is not one singular voice, right? So people who are living in poverty, women who are living in poverty, mothers who are living in poverty, these groups are overlapping but distinct. The needs are overlapping and distinct. And part of the way that we can assess those needs is to actually involve those people in the decision-making process. So not to sort of stand above the fray and say, I think I know what everyone needs, but to figure out how do we bring these folks into the process of making decisions about the next best steps here, and democratize in our practices whose needs are centered.
Thank you. Dr. Block, please.
I really can't add much because we've touched upon a lot of things. So this isn't really advice about what to do, but more encouragement that people should do something. And as a person who occupies two departments, one where public facing work is more respected than it is in another department. So Dr. Benjamin knows exactly what I'm talking about with that fam and poli-sci, right? I feel like what happens in general, what's really been happening post-pandemic, is that a lot of our professional lives feel arbitrary and somewhat meaningless. And so like there's the job, but then there are the things we can do to make sure our communities are okay. And some of those things are small things, but the small things matter. And it's okay to do the small things. It's okay to donate to food pantries. It's okay to write the op-ed, even if you don't think the op-ed is something that's going to be really, really important to your dossier later on, right? There are these things that we are equipped to do that we are uniquely suited for that matter. And I encourage everyone to pursue those things now and not to feel like you have this partition between what your job does and what your heart calls you to do, because I feel like this is a time when there's a lot of overlap between the two. So again, not necessarily advice about what to do, but do something. And it's okay to do something. It's okay to be an activist right now.
Thank you, Dr. Block. Before I turn this back over to Dr. Franklin, I just want to offer my profound gratitude to all of the panelists today who have given of their time and their expertise, who started this conversation. I want to thank all of the attendees. I've been amazed. This is a Friday evening, and we are talking about what we can do to empower community and to protect community. So I thank you for that. My profound wish and prayer is that all of you will be well, that you and your families will be protected. And to echo so much of what we've heard, as we think about what we can do, what we must do is extend grace to ourselves and to others as we all just try to figure out how we get through to the next day and to the other side. Dr. Franklin, it is now in your hands.
There you go. I want to thank each of you for joining the panel. Ray Block, Jonathan Collins, Andrea Benjamin, Keisha Middlemass, Jamila Mitchener, and Lakita Bonnette-Bailey. And in closing, I want to say that there are a few of the attendees who raised their hand asking for a set of live questions, but we built in a security system to try to combat, Zoom bombing and bots. So for those people who want to ask live questions, I strongly encourage you to direct message us at our Twitter account which is at NCOBPS Tweets. at NCOBPS tweets, and we'll try to find a way to facilitate those questions to the panelists. In closing, I want to make sure that I lift up, if you can see that screen again, the Executive Council of NCOBPS. I want to make sure I lift up Dr. Kalila Brown-Dean. This is her brainchild to have this webinar, and she deserves many thanks, many gratitude for pushing NCOBPS to have this webinar. Alexis Harris of Clark Atlanta University, who helped out with advertising. Tanae Franklin and Health Leads USA for co-sponsoring this event. And finally, what I want to say is that I want to make sure that we lift up in the spirit and blessings and in gratitude of those individuals who have lost family members to the coronavirus, and those individuals who have been laid off and are experiencing trauma in this period of time. There are some NCOBPS members who have lost close family members and friends, and we want to make sure that we lift them up and keep them in our spirits and in our blessings and in our prayers. So I want to make sure that we point that out as well. Finally, this town hall will be posted on our website. Hopefully we can get up as early as next week. If not, definitely before the end of the semester. And that's all I have to say. Dr. Kalila Brown-Dean, I'll give you the last word since this is your brainchild.
There's nothing else to say but find joy in every day, find purpose in your day, and we wish you health, we wish you wellness, and thank you so much on behalf of the National Conference of Black Political Scientists. Be well, everyone.
Thank you.
Thanks, everyone.